to call the Health and Human Services Finance and Policy Committee meeting back to order. And we are beginning our evening session with Senate File 4486. Senator Hoffman.
Thank you, Chair Wiklund and members. I don't like being late, but I was following a certain member of your committee to room 1100, then 1150, then 1200, and then he got a call that it's in G15, and then he got another call that said we're in 123. So I did a whole tour, Madam Chair, of this whole beautiful building. But I'm here today to present legislation that absolutely will save lives and improve access to care for Minnesotans who are struggling with opioid use disorder. It's an estimated 40 to 55,000 Minnesotans are living with an opioid use disorder. That impact is significant. Minnesota Medicaid alone spent $465 million in 2022 related to opioid use and so disorder, with more than 4,100 emergency room visits and this is the one that gets me, there's 1,000 overdose deaths in 2023. And for every one Minnesotan who dies from an overdose, nearly 15 are treated for a non-fatal overdose. Those are critical moments where interventions could change the course of someone's life. Yet too many people never receive that help, Madam Chair. Only a fraction are able to ever receive that. And too often when somebody is ready to seek help, there isn't a provider who's available. Those moments matter. And when care isn't available, the opportunity to recovery is lost. Senate File 4486 addresses that gap by authorizing pharmacists to initiate, prescribe, administer, and dispense medications for opioid use disorder. Pharmacists are among the most accessible healthcare professionals in Minnesota, with nearly 90% of Americans live within 5 miles of a pharmacy. They are already trusted providers delivering immunizations, medication management, and preventive care. This legislation just simply expands the access to evidence-based treatment by leveraging an existing highly trained workforce. Timely access to the medications for opioid use disorder is proven to reduce overdose deaths and improve long-term recovery outcomes. By reducing delays in care, we can strengthen Minnesotans' response to the opioid crisis. Other states, Madam Chair, have already taken these steps, and federal policy this past December moved in the same direction. And so the bill builds on strong safeguards. Pharmacists are the licensed professionals, Madam Chair, with extensive training, including patient care, and they routinely collaborate with other providers to provide that safe and assuring environment. With me is Jordan Bannister. She's with PharmD and Ambulatory Care Pharmacist Center Care, and then Holly Drone, who's a clinical pharmacist in the emergency medicine and emergency medical services, EMS. So, Madam Chair, testifiers.
Thank you, Senator Hoffman. And whoever wants to go first, if you could please state your name for the record and begin.
Chair Wiklund and members of the committee, my name is Jordan Bannister. Thank you for the opportunity to testify in support of Senator Hoffman's Senate File 4486, permitting independent pharmacists prescribing a buprenorphine to treat opioid use disorder, or OUD. I serve as a board member of the Minnesota Pharmacists Association and am proud to represent our work here today. I'm also a clinical pharmacist at Centricare and manage medications for patients in central Minnesota. While I am trained in the treatment of opioid use disorder, current limitations prevent me from utilizing that expertise under my own license. Not every provider feels comfortable prescribing buprenorphine, and this creates critical gaps in care, especially in our rural communities. Pharmacists are highly trained medication experts who are well positioned to expand access to this life-saving treatment. This issue is also deeply personal to me. My brother's best friend, Michael Peterson, died of overdose at just 24 years old. He was family to us. I can't think of a single concert or lake vacation without him there. Losing Mike left a lasting hole in all of our hearts. His death is a powerful reminder of why access to treatment matters. Mike used to tease me about being book smart and always studying, so I really hope I can make him proud by putting that knowledge to meaningful use today. With my younger brother's permission, I'd also like to share his story. He began struggling with opioid use disorder as a young teenager. After losing Michael, he realized he needed to find a way out. Treatment with buprenorphine saved his life. Today, he is married, has 2 beautiful sons, and is thriving in his career. I've seen both sides of this crisis, the devastating consequences when people cannot access care, and the incredible recovery that is possible when they can. Every person deserves the same chance at life that my brother was given. This bill will allow pharmacists to start or continue buprenorphine for patients who need it, whether that be in a retail pharmacy in a small rural community, emergency room, jail, hospital, or clinic. This care would not take the place of physician management. In fact, we'll use this care to encourage referrals to our doctors after initiation and work in collaboration with them to care for our most vulnerable patients. I respectfully ask you to support Senate File 4486, and I'm happy to try and answer any questions you have. Thank you.
Thank you very much. Ms. Drone, if you could please state your name for the record and begin.
Thank you. Good evening, Chair Wiklund and members of the committee. My name is Holly Drone, and I am an emergency medicine pharmacist practicing in downtown Minneapolis. Every shift, I respond in real time to overdoses, opiate withdrawal, and cardiac arrest related to opioid use disorder. I also spend time working on the street alongside paramedic crews in the field where these emergencies often begin. Across Minnesota, we still have major gaps between opioid reversal and access to treatment. I am currently also part of a statewide grant supporting 5 emergency departments working to increase access to buprenorphine for patients with opioid use disorder. When treatment is available immediately, patients are far more likely to engage in recovery processes. Even if this medication is started in an ER, the most critical time post-overdose, patients lack timely follow-up options, especially in greater Minnesota. We are at a critical point in the opioid epidemic, and I urge you to expand access to this safe and effective treatment via the most accessible healthcare providers in your community. If pharmacists had prescriptive authority for buprenorphine, we can expand access in multiple settings, including clinics, community pharmacies, and outreach programs. Pharmacists could initiate or continue treatment when other providers are overbooked or are uncomfortable doing so. Last year alone, our emergency department provided over 1,000 prescriptions for buprenorphine to patients who lacked access to outpatient care. That number reflects both the scale of the need and the importance of having more accessible healthcare providers who can prescribe this life-saving medication. As Jordan said, pharmacists are your highly trained medication experts who already manage complex therapies every day. In fact, I train other healthcare providers, including paramedics, how to safely and effectively administer buprenorphine on 911 calls. Granting pharmacists prescriptive authority for buprenorphine would help relieve pressure on busy emergency providers, primary care systems, addiction medicine centers, and expand timely access to treatment to underserved communities. Like Jordan, this issue is also deeply personal to me. Of the 1,000 people who died in 2023, my brother-in-law was one of them. Expanding access to treatment means more Minnesotans have the chance to survive and recover. Thank you for your consideration.
Thank you. Thank you both very much for your testimony. Next, we will go to Zoom, and I believe we have Robert Cole-Peringer. If you could please state your name for the record and begin your testimony.
Yeah, thank you. My name is Robert Cole-Peringer. So Chair and members of the committee, like I said, my name is Dr. Robert Cole-Peringer, and I'm a medical toxicologist, addiction medicine specialist, and internist at Essentia Health in Duluth, Minnesota. I also serve as the medical director of the system-wide substance use and addiction care program at Essentia Health, and also as a board member of the Minnesota Medical Association. I am also in recovery and have been sober as of February for 15 years. Buprenorphine saved my life, and I am here to testify in support of SF 4486. So taking a step back, opioid and fentanyl overdoses are the leading cause of death for people ages 15 to 55, and by some margin. St. Louis County, or Duluth, has the highest overdose rate in the state, also by some margin. We have 2 medications that keep people with opioid use disorder alive and allow them to live a normal life: methadone and buprenorphine, nothing else. The evidence for their use is profound. Start 3 people on buprenorphine and you save a life. In greater or northern Minnesota, our options are limited. There are only 3 methadone clinics north of the Twin Cities, which limits its use. As such, we are reliant on buprenorphine, which has the added benefit of preventing overdoses when being taken at therapeutic doses. But we are limited to providers comfortable administering and prescribing the medications in clinics. which many patients cannot access. This is woefully insufficient, particularly in rural Minnesota, where accessibility is the single biggest obstacle preventing patients from being started and maintained on this life-saving medication. Allowing pharmacists to start or administer buprenorphine would be a game changer and substantially improve accessibility. This doesn't replace physician or advanced practice provider visits, it complements them. In addition, the future of buprenorphine administration is long-acting injectables. Pharmacies can store these formulations more easily than clinics, and many pharmacists are capable and willing to administer buprenorphine, sometimes more so than physicians, and they do it safely. We need this in rural Minnesota. I wholeheartedly support this bill, and my addiction medicine colleagues around the state, including Dr. Brian Grahan, Dr. Ryan Kelly, Dr. Kurt Devine, and others, are also strongly in support of SF 4486. Thank you.
Thank you very much. Then I have Cami Lavalle, if she could state your name for the record and begin your testimony.
Yes, hi there. My name is Cami Lavalle. I just thank you, Chair Wiklund and members of the committee. I do support this bill, and I want to thank Senator Hoffman for introducing it. I think this is needed for people with opioid use disorder and to make sure that they have the care they need and not have to end up in the emergency room or worse. My concerns with this bill is just a couple things in the language if they were to be misinterpreted or misapplied. And so I just wanted to bring up the concerns as I wanted to ensure that a pharmacist could not unilaterally interfere with an existing doctor-patient relationship. For instance, say someone who has a medical necessity for opioid analgesics for whether it's cancer or rare diseases or something of that nature. And some of the language, there could be room for interpretation that the pharmacist may have authority to do that. So that was one of the concerns I had with the language. In addition to some of the language has that the pharmacist can initiate based on their assessment, but there is not a description of the assessment. And one of the concerns I have is if someone's going to be looking at the PDMP and looking at the NARC care scores when there's not a lot of details about the actual patient, and if those decisions might be made solely based on an MME or a NARC care score in the PDMP, those are some other concerns of mine. And if they were to be able to initiate medications for opioid use disorder for someone who doesn't actually have it. And so those were some of the concerns. And if there was any language in there where someone could answer the questions, that would be great. And if there is an opportunity to put language in there just to prevent any misapplication or misinterpretation, something to the effect of this section does not authorize unilaterally changes to someone's existing treatment plan or drug therapy. And again, I do support the bill. I'm just concerned about unintended consequences of some of the language. Thank you very much.
Okay, thank you for that. And last on Zoom, I have Dr. Todd Hess.
Yes, I'm coming on right here. Okay. Thank you very much for having me, Madam Chair. And again, Senator Hoffman, thank you so much also for presenting this. I'm actually a pain management specialist, trained at Mayo Clinic over 30 years ago and ran a large pain program in the Twin Cities. And so I come from the pain management perspective. I'm also a pain patient myself. I do support the bill, absolutely, and I'm also from rural Minnesota, so I understand the issues we have. My concern is along the same lines as Cami, is who has made the diagnosis of OUD? And when I read the bill, that was my only concern, is if this would be misapplied. The reason I bring this up is I did a lot of cancer. I've treated thousands of Minnesotans with opioids, and very successfully. And many pain patients do not go on to have opioid use disorder. So how can we make sure that the right patient has the right diagnosis? And so what I wanted to know is who would make the diagnosis of OUD? Would the pharmacist make that on the spot? Or would that be a physician-driven collaborative? And again, I support the bill. I like the MMA's letter that Dr. Lisa Mattson sent, and we as the MMA really do support the bill. But just wondering about the collaborative part of it, the follow-up, if there was a complication from the medication, who would be responsible for it? So for me, it's a thing of language also. Absolutely agree with Dr. Robert of the necessity for it. The safety for an OUD is absolutely there. It's when it's used for pain management. And I think one of the personal concerns I have is I had been questioned numerous times by pharmacists by my dosing, especially in cancer patients, and they don't agree with the dosing. Could they put one of my patients on buprenorphine just because they disagreed with the MME that I was doing, even though I work in collaboration with addiction specialists and other physicians? So who's going to be responsible if there is a fallout or if there's a complication? And so I, like Cammie, would say, I would like to propose amendments to just some of the language of the bill, just to make sure that pain patients aren't all subjugated to the point of being diagnosed with OUD. Many pain patients can live very well on opioids, do not have substance use disorder, and do not have OUD. So some of the language I would like to see in is just to make sure that there's not a unilateral diagnosis. And if the pharmacist disagrees with the physician's diagnosis, how would that be adjudicated? And I wasn't sure, Senator Hoffman, if that had been addressed or if that question had been raised. So I'm here to raise it. Again, support the bill. Absolutely need it. I think pharmacy is the best, and I agree with Dr. Robert, that in the end, long-term injection is going to be the place, and that absolutely would be pharmacist's purview of the ability to get. I get my vaccines at the Walgreens by my farm in Cambridge, so I understand very much the power of pharmacists. I also know how busy they are, though, too. And this is one more burden on some of them that they may not want, especially the fallout if it's misapplied. That's what I have to say. If there's any questions, I'd be happy to take them. If there's any response to my understanding of this, please let me know.
Okay. Thank you, Dr. Hess. Senator Hoffman, did you want to make any comment about that, or your testifiers?
Yeah.
Or do you want to take that back? So
yeah, thank you, Madam Chair. And yeah, Jordan has some. We looked at this. If you look at 151.37 or 151.01 subdivision 27, what was initiated in the comments from people, that should all be covered underneath those sections. But I'm just going to let Jordan Bannister respond to that. But I think I don't see anything that's missing here, Madam Chair.
Ms. Bannister?
Yes, thank you, Madam Chair. And I appreciate the questions, and I want to be very clear, this is in no way something that would allow us to change a prescription from a doctor. And not every pharmacist will be doing this. We do need to complete the 8 hours of required DEA training, just like any other mid-level provider who would be providing this care. Pharmacists who work in a very small community and see the need may do so, but you might not see that in a busy CVS or Walgreens. One case where I could see a pharmacist in a busy Walgreens using this is if they receive a buprenorphine prescription for a film and need to switch a patient over to a tablet if that's what they have in stock. As we know, sometimes it can take a while to hear back from providers, and even waiting a few hours or a day can mean someone returns to use and ends their chance at recovery. Certainly understand the concern, but we made sure to be very careful with the language that it was specifically for treatment of opioid use disorder. This is something that would be done via patient request. This is not something that we would be forcing on any patients. And I believe Dr. Cole Peringer has his hand up for comment as well.
Dr. Peringer, did you have a comment?
I do. Thank you. No, I appreciate the conversation. I disagree with Cammie and the other physician in regards to some of the language. I think there's a very clear distinction between patients presenting with opioid use disorder and those with chronic pain. Yes, there can be some overlap, like some messiness in patients with chronic pain, but that's not the population we're trying to, that is not the population we're trying to help. We're trying to help those patients that don't have, that clearly have opioid use disorder, that say that they have it, that say that they are in withdrawal, like the kind of analogous to when EMS providers start buprenorphine after an overdose. There is no like confirmation, does this patient have opioid use disorder before we start buprenorphine? We start buprenorphine in large part based on what the patient says right there. And it's the same thing, I think, in the pharmacy. Whether we have language around that certainly can be added. But I think it's a very distinct population without any, frankly, overlap between chronic pain and opioid use disorder of the patients we're seeing.
Thank you. I'm going to stop that particular conversation. Senator Hoffman, if there are other questions that people have and wanted to send them to Senator Hoffman to examine, but given our schedule tonight, I think we'll have to leave that question there. It sounds like it's been addressed in the bill, but if you think of anything else that should be addressed, please, feel free to let us know. Any other member questions or comments? I'm sorry, we didn't have any discussion. Senator Utke.
Thank you, Madam Chair. And I had a question related to training over what you currently do, and I did hear just at the end there's an 8-hour training to get up from the regular pharmacist to be qualified for this. Is that correct?
Ms. Bannister?
Yeah, thank you, Madam Chair. Senator Utke, that is correct. 8-hour DEA training. We are also very fortunate, this group of pharmacists who have been working on this. We have experts in the field, Dr. Peringer, Dr. Devine. They do echo training. I'm actually attending a training with them in April as well. So they give us all the most up-to-date knowledge, and we're very grateful for that collaborative relationship with our physicians.
Senator Utke?
Thank you, Madam Chair. And just one last thing related to how you bill this, because it's something new. Has that been worked through and you know exactly how you're going to do that? And Senator Hoffman really appreciates a money question.
Ms. Bannister?
Thank you, Madam Chair and Senator Utke. Yes, right now, as it stands, we could bill this under MTM or medication therapy management services.
Senator Utke?
Thank you, Madam Chair. That's it. Appreciate it.
Any other questions or comments? Seeing no other questions or comments, Senator Hoffman, any final thoughts before we lay the bill over?
No, Madam Chair and members, and you're going to send this, you're going to lay it over into your, right? Okay. And thank you, Madam Chair and members. This absolutely was well thought out, and it's good. And I think losing 1,000 lives in 2023 is enough said. So thank you.
Thank you, Senator Hoffman. I think it's really an important topic and an important action we can take. So Senate File 4486 is laid over. Members, we're going to switch the order. Senator Pappas isn't available yet, so we're going to move to my bill, Senate File 4719. And I would just ask people in the audience, if you aren't interested in other bills over the evening and, once we get finished with the bill you're interested in, there are people waiting outside to have a seat. So hopefully we can have, if you aren't interested in the rest of the agenda, you can take leave, and then others can use your seats. Thanks.
Hey, Senator. Hey, how are you?
Good. I thought everybody was here.
All right. Senator Wiklund, when you are ready and settled there, you can begin to tell us about Senate File 4719.
Thank you, Madam Chair. Senate File 4719 is an IT modernization bill. The topic of IT modernization for human services systems is one that we have had discussions about in this committee this session, and we have had discussions in past years as well. This bill is intended to bring forward tactical systems focused and policy focused projects, along with a structured system steering committee to formalize joint county agency planning and development of operational and human services systems recommendations. I'm sure many, if not all of you, have heard about IT modernization concerns from your own counties and heard how it impacts their workforce, their budgets, and their clients. Last October, I was able to see a demonstration of these state IT systems firsthand in Ramsey County, and I know many of you have had a chance to do that as well. There I watched as systems administrators showcased Maxis, which is a 1980s state IT system that's used to help with SNAP eligibility. And these workers demonstrated what it's like to operate in this system on a daily basis, showcasing the inherent inefficiencies, workarounds, and overrides that they must go through on each case. These burdens represent more than just inefficiencies, however. They represent budget and levy hardships for counties having to hire additional staff and present negative impacts to program integrity when the systems don't help to identify anomalies or mistakes, whether unintentional or not. While we made progress last year in a bipartisan way on updating one of these legacy systems, SSIS, there is still more work to be done. It's clear that there needs to be a multi-year approach to modernization that includes both the immediate and the long-term vision for systems replacement. This bill is focused on short-term, immediate needs and is based on the feedback and hard work of our county IT staff putting together their desired recommendations. And now I will turn it over to the testifiers to give you a greater presentation.
First we have, I think, Mr. Wagner. Okay, very good. Mr. Hilgert. Please introduce yourself and present your testimony.
Thank you, Madam Chair, members of the committee. Good evening. My name is Matt Hilgart. I work for the Association of Minnesota Counties. AMC represents all of Minnesota's 87 counties. And tonight, I also have the honor of testifying on behalf of the Minnesota Intercounty Association and the Minnesota Rural Counties Association. So those are all the county organizations here at the Capitol. I want to thank the chair for her leadership on this issue, especially during the interim where she spent her summer and fall days as well with county folks, as she mentioned in her testimony, watching these systems. And I also want to thank, I think, the majority, if not everyone on this committee who has seen or actively consulted with their county on these demonstrations. I know Senator Curran, you've seen this firsthand and up close. I thank you. I think if you're not on the bill, you'll be on the bill. Senator Uckey, you've heard from your folks on this. Senator Port, who's with us virtually, held a hearing back in fall about this issue. Senator Boldon, you have a longer-term vision, so we could continue going down the committee list. But I know this topic you are all familiar with. And so thank you for the seriousness of what you're giving it. And also to the partners that we have. For the first time ever, the Association of Minnesota Counties is on a list with health plans, hospitals, the Chamber of Commerce, and the Business Partnership. As we talk about all the things that these systems impact outside of just county workers or clients or property taxes, I think that's an important reminder, this letter right here, that this also affects our business community. This affects our health plans. This affects our hospitals too. So thank you to those voices who spoke out tonight as well. We'll get started today. I know we gave you a short, brief taste of this earlier this session about modernization. I think we demonstrated one screenshot, and we left you all with the anticipation of, we hope we'll come back and give you a demonstration. And that's what you're about to see tonight, an 8-minute demonstration about Maxis and Mets combined together. But before we do, I do want to just put this out there. For when you're watching this presentation, be thinking about this presentation through the lens, or through multiple lenses. The first is the staff and workforce impact, and I know we have some staff in the room today, but think about it, what it means to try to find and hire staff and workforce in a very tough and challenging environment, and for their first thing to see these systems and go, wow, I studied for social work, I studied to help people, and they see the green screens that they're entering for their career. The second is the property tax pressure. We'll talk a little bit about case ratios later tonight, but the fact remains is that these systems aren't just inefficient, they're burdensome for the levy and budgets for your local communities. In the state of Minnesota, we are one of 9 states where we administer social services through the county lens. So we are disproportionately already using the property tax system to fund this workforce. And so if our case ratios are a third of our states that are next to us, just think about what that means for the efficiencies of hiring and what that means, Senator Utke, for your own tax district, which is extremely burdened. When they're hiring folks, this is multiple percentages or points on their levy. And I know that that story impacts a lot of folks on this committee. The third issue is fraud prevention, identification, and program integrity. It goes without saying when you see the next screen come up, a green screen literally, it goes without saying that these probably aren't the most effective systems to speak to each other, to query addresses, to use AI tools to try to catch discrepancies, whether they're intentional or unintentional. And the last one, which is an important reminder for all of us, and I know this committee always keeps front and center, is the client focus of this. We are still, these programs, these systems, these policies are set up to help individuals and families in times of crisis or need. And when these systems aren't effectively working, it's not just an impact on us, it's an impact of the people who are turning to these systems and saying, where am I in this process? Where am I in the queue? I sent in this application, I've been waiting weeks. Will I be able to get this surgery? So it's impacting all these different categories. And with that, I'm going to turn it to our colleague, Zach from Dakota County, who will be giving you a demonstration on the day of the life of Maxis.
Mr. Wagner, please introduce yourself and begin.
Hello, excuse me. My name is Zach Wagner. I am a trainer in Dakota County. My job is to train new workers in the system of Maxis to be able to determine eligibility for Minnesota residents. The screen you're looking at is the main screen that we use in our Maxis system. This is the system that we use to determine that eligibility. One of the important keys to remember with that, so we need to have a computer, and it's very helpful for us still in 2026 to have a pen and paper at our side to write down notes, as the system does not work well within itself. I have a application that I spent about 45 minutes entering by hand earlier today that I'm going to just walk you through some of the panels on this. We're going to start in our stat function. And I'm going to go through the command PNLP, which I'm sure are codes that do not mean much to you. It's going to show us through, I've been passworded out, so 1 second while I password back in. I'm going to queue up these panels that I entered so you can see what these screens look like. We start with some address information, all entered manually. Some more member information, additional member information. Again, all of this is entered manually. We come to the work reg panel. This is a very important panel for workers to get right for both the SNAP and for cash assistance in Minnesota. There is assistance through the state in the form of 9 different pages of help for us to try to understand this one page. One of those pieces of help is 6 pages long. So it's very important, but also very confusing, and there's a lot of information that workers have to remember and to be able to enter in manually onto this page to get it correct in eligibility. We have information about disability for this case. We come to the review panel, information about review. I just want to note on this panel, I have told Maxis on this panel that this is a case that needs a 6-month review, just as a point that'll come back to that later. This is the jobs panel. This is a very important panel to get correct eligibility, as it is where we enter the income that the client has. We actually need to enter income on 3 different places on this panel. On the main page here, we enter it. We found through the application process and verification process that they receive $344 a month. We enter that on the main page. We also have to enter that in 2 different panels, one called the Food Support Prospective Income Calculation, where we enter that information manually again to get that amount, and then also the Cash Prospective Income Calculation, entering the exact same information a 3rd time on this panel. At that point, I am able to move into determine eligibility. I do have to use a manual override in order to get the cash system to work. So I'm going to go into our cash system eligibility results using our fiat system. I'm going to use a code that we know through a list to do the cash and select GA. At this point, I'm going to select the applicant and a few other fields that I need to view. We see that the person test results and case results are passed as we expect. When we get to this page, remember I have already entered in the earned income 3 times to Telmaxis. At this point, I do actually have to tell the system again what the income is because it doesn't actually read its own information. So I'll enter in that income one more time, a 4th time. It brings up our results. We have $57.04 in a GA amount. I also actually, if you remember, I said I had told Maxis that this is a 6-month reporter. I actually have to tell Maxis again there that this is a 6-month reporter to get results. And then I can move out. I will save that. So I have created results for 1 month. For sake of time, I won't do the 2nd month. We have to do 2 months at a time. I would go in and create another month doing the exact same thing. So that would actually be entering the income a 5th time. After that, I would go into the food support. I need to use a separate code because the cash program benefit is income for the SNAP benefit, so I do have to use that first. And then we go into food support. We only have to look at the budget here, luckily. It has pulled in the gross wages for SNAP. Unfortunately, it has not pulled in anything for the other PA, public assistance benefits, for the GA that I had just approved. So I do manually have to go in, and hopefully I have written down my notes correctly from the previous results, or I have a very good memory and I'm able to put in the amounts correctly. And there I have created the results for $67 of SNAP benefits for this case. As you can see, there's quite a few places in this process that a worker needs to use their own mind, their own notes. Maxis does not read itself. At that point, I think I'll hand it to my colleague Tiffany to go over the METS system.
Please introduce yourself and proceed.
Thank you. Hello, my name is Tiffany Miller Sammons. I am a deputy director at Dakota County in Employment and Economic Assistance with over 20-some years of Maxis. And I can say that as that 20-plus years of Maxis experience, Maxis has changed, but for the worse, in the sense of it takes longer to process than when I was a financial worker 20 years ago. So we then go to METS, which, does it show? To METS, which I'm going to show you, and look at the beautiful white, update, modern-looking system that we have in order to process eligibility for our Affordable Care Act eligibility for health care. So it looks great. Folks come in and they're, user-friendly. But I'm here to tell you that a majority of our Maxis workers or that are now in METS would say, I would rather work on Maxis than in METS. So just to give you a little bit of background on why that is. So there is a great benefit with, so don't get me wrong, METS, 90% of our applications coming into Dakota County, a worker doesn't need to key that information in. So as you heard Zach say, 45 minutes to key in that application, we don't need to do that. Unfortunately, due to system functionality, whenever there's an issue with the case, so for an example is second pregnancy, that second baby can't be added to the case just as we would normally do within Maxis and take maybe 15 minutes. You unfortunately have to close the case in METS and re-enter, so re-type in everything that if this was one of those applications that were 90% entered by the customer, carried over to the system, we would need to then re-enter all of that. So there's benefits, and then we do end up having to re-enter those applications more often than what we would like, because that is one of the top solutions when the system is not providing the eligibility. The other piece that we see, because of the online system allowing individuals to apply and possibly experience what we call a happy path. So they go in, they apply, they provide all the information. They don't even need to talk to a worker, because the pings to the deed to any source of verification, it allows them to move through. They're able to verify everything automatically. Fantastic. About 45% of the applications go happy path. However, that work, because it's very much on the front end of verifying who you are, if accidentally spell your name wrong, or you use Matthew instead of Matt, you could be creating a duplicate case and a duplicate SMI number, state master index number, which then creates further challenges down the road as you're trying to receive services. And just in essence of time, one other kind of key thing that I'll make note of is that how you saw Maxis, to where we can go into any panel, we can update any panel. Oops, we forgot this. We're going to go back and enter it. Within METS, it is very prescribed and does not allow for any deviation. So when we train a brand new worker on METS, we say, you have your screen with METS, you have your documentation that you're needing to enter, and then you have a third screen that tells you step by step what to do. And you need to make sure that you follow those steps, because accidentally, if you miss a step, it could create that whole case to be closed and re-entered, and you have to start all over again. Stand for any questions.
Thank you.
Mr. Hilgert.
And Madam Chair, we have one last testifier, elected county commissioner, and as she approaches, I think I'd like to underscore too that the fact that it takes us almost 2 years to train an employee to become quote unquote fluent in these IT systems, that your constituents are calling us asking, where's my benefit? That should tell us everything we need to know. It shouldn't be harder to learn these systems than it is to learn a language. And the second component of this, and we use this for our House Ways and Means demonstration, is that just the policy manuals for learning these systems that people have to go through can be over 1,000 pages. Some aren't printable. You have to look at them from PDFs on a screen. But if I were to show you, it'd be 2 stacks of reams of paper just for Maxis alone, and that's not even met. So I'll turn it over to Commissioner Barb Weckman-Brecky from Scott County, and then we'll stand for any questions.
Commissioner, please introduce yourself and begin.
Thank you. Thank you, Chair, members of the committee. Thank you for the opportunity to testify today. My name is Barb Weckman-Brecky, and I'm a Scott County Commissioner, and I also serve as Vice President of the Association of Minnesota Counties. I'm here to speak in support of Senate File 4719. Counties are the administrative arm of the state. We carry out the eligibility work, the case management, the documentation, and the day-to-day operations that make many Minnesota human services systems function. But we do all of this within state-owned systems that we do not control and cannot improve on our own. You just heard about 2 of those. Right now, those systems are not keeping up with the job that they are being asked to do. In the counties, we're facing unprecedented pressures on workforce, shortages for people who want to do this type of work, rising caseloads, increasing program complexity, and greater expectations for accuracy and program integrity. At the same time, we are absorbing a historic level of federal policy changes, adding more layers of eligibility work, documentation, and verification. And yet, we, or the staff that work for us, are expected to deliver all of this using systems that are nearing their 50th anniversary, half a century. Systems that still require manual input from electronic applications, systems that were never designed for this level of volume or complexity. And let me be clear, we are being asked to run a modern, high-speed human services system on what is essentially a horse-drawn carriage. You can add more people, you can push harder, but the system itself was never built for this scale or speed. And when that carriage starts to break down, counties are left trying to keep it moving by adding more staff, creating manual workarounds, and absorbing more administrative burden. This is not a sustainable model. This is a system being pushed to a breaking point. We are very close to that breaking point. We cannot hire our way out of this problem. We cannot continue pouring local property tax dollars into propping up a system that we do not control. And we cannot continue shifting the costs of state program inefficiencies onto local taxpayers. When state systems are inefficient, those costs do not disappear. They shift directly to the property tax levy. In Scott County alone, federal and state policy impacts combined with the failure to modernize have the potential to add millions of dollars to our levy. That means higher costs for homeowners, renters, and businesses, not to improve services or do more, but simply to maintain a system that's falling further behind. This is not just about whether counties deserve modern tools. This is really about responsible government. Without modern integrated systems, counties will not be able to continue performing these functions at the level that all of you, all of us, and our constituents expect. Senate File 4719 recognizes that modernization is not just a technology upgrade. It is a foundational investment in the future of our human services programs. This bill provides a clear statewide modernization plan that finally puts counties in a co-pilot role in decision-making and prioritization, a governance and accountability structure that include legislative and stakeholder oversight, a roadmap for replacing these siloed systems with integrated, efficient tools, and a commitment to reducing administrative burden while improving accuracy and outcomes. I will be candid, and my colleagues around the state will agree. I still believe we must move quickly as possible toward fully replacing these systems with something new. But this bill makes one thing clear, that we cannot wait any longer, because right now we are not fixing the engine. We're just asking more people to push the carriage. And every day that load gets heavier, the system gets weaker, and the cost to taxpayers grow. There's not a single county in this state that does not see this as a top priority or fear what continued delay will mean for our workforces, our budgets, and our property taxpayers, as well as the people we serve. So we really ask for your help and support in making modernization a priority this session. I thank you for your time, for your attention, for continuing to sit through these demonstrations, which are painful just to watch, much less do every day. So thank you for your time. Thank you for this bill.
Thank you for your testimony. Senator Wiklund.
No, I think that speaks a lot, seeing the demonstration, and I'm happy to answer any questions if members have them.
Questions or discussion, members? Senator Cran.
Thank you, Madam Chair, and thank you for everyone who testified. It's shocking anything works today, and to have green screens and duplicative entry, that was by choice or abandonment. I think it was both. And so as you move along, and Senator Wiklund, I think we're going to have to really stay on top of it. I know you have been. The short-term goals, from the bill perspective, it's just we've got a lot of patchwork identified. Whatever we can do rapidly to execute or expedite the SNAP eligibility, data integration. How can we build that either within or outside of the systems right now? Whatever it is, we've got to figure out a way to quickly automate as much of that as possible, knowing it's not the fix. On one of the slides, we talked about the RFP process going along for the social service information systems. Does anybody have a ballpark today from a procurement perspective of, are we looking at replacing this myriad of systems with 1, 2, 3 providers from what we currently have? Do we have the research that could prove we have a vendor who could provide 80% of the services we're looking for? Could somebody give me an update?
Mr. Hilgert?
Madam Chair, Senator Coran, thank you for that question. We have Dan Jensen from Olmsted County who's going to be coming up. He's been involved in some of the SSIS work, so he'll be able to answer.
Mr. Jensen, please introduce yourself. Welcome to the committee.
Madam
proceed.
Chair, Dan Jensen, Associate Director, Family Support and Assistance from Olmsted County. We've been working diligently. Well, first of all, thank you for your support for this bill. Thank you for the support for starting the replacement of the SSIS system. That was a critical first step. And we've been working diligently on moving that forward. And we believe that there are vendors out there that can be able to handle and to manage this. Are there, and I think more specifically to your question, are we looking at a number of individual products that would come together to replace all of our systems? I describe this often as a parking lot full of broken down cars. And are we just going to replace each single car with a brand new car, but none of them communicate with each other? Our hope and our desire is that we can get to an integrated system, and we call that the airport model. And through the airport model, we need to focus on integration. If we replace individual systems and we continue to have to update the address in every single separate system, we are getting nowhere. We must have an integration layer where we're able to enter the address once, we're able to have critical documents entered once, and they're able to be used in a secure manner across the entire system. Those tools are now available. They are available through a variety of options. We can do that through a single source vendor. We're also able to do that through a variety of vendors because technology has advanced where now those the tools will communicate with each other in ways they didn't in the 1980s or the 1990s, or right? So this long list of tools that we need to get replaced, we think that this is going to get us started into building some of the muscles and building some of the experiences that we need to get to the integration, and we believe that the tools are available for us to be able to handle and move this forward. Thank you.
Madam Chair.
Senator Coran.
Thank you. Yeah, I appreciate it. I think, you just described, well, we're going to patch it with a lot of modern screen scraping and carry forward of data, right? Integration of those things, but you still have fundamentally a terrible car that's been through the shredder, and somehow we put new wheels on it a little bit. We go a little bit further. I think when we move through each of those, I still don't think I don't think the agencies have invested enough time in your business, living in your world, doing your work every day. Steering teams are still, don't cut it to me or for me. And so with that, I don't think they're going to do it because they haven't done it in my entire time here. And until we acquire that knowledge at the expert level, for all the users, every single element, and even within their own agencies, the users they have embedded within, I don't think they've invested enough time to accurately portray and articulate in an RFP or a procurement process to be able to get the best solution. So in lieu of that, I think we're going to have to really focus on the procurement process. And once we define, I think you know what your needs are globally. And in the procurement process, we're going to need to, and Senator Wiklund, I think we need to dictate that we use an invitation to negotiate process. It's the only process, we've done it on large IT projects. It's not codified that we should do it on everything, but we sure as heck should be doing it here. We have to, through that process, extract the best known knowledge that exists in the industry and around the country through that process. We'll attempt to articulate our needs best possible, but in the current traditional procurement process, it just doesn't work. For the vendor or the agency of need, and it maybe works from admin because you get a contract. At the end of the day, we need to have a contract that's a foundation for success. In addition to that, I would expand it beyond the traditional procurement process. When we do a down select, we won't go into invitation to negotiate today for everybody, but when we do the down select and go to the final down select, I think we need to take the time and actually test drive the application for that process for a month, whatever that takes. If it's a month or 2 months, it's money well spent up front, and to ensure that we know what is vaporware yet to be developed relative to a configurable application and have it proven in whatever client sites that they're at before we sign that final contract with updated service level agreements. So we as a state have a foundation for great success. The vendor community can actually meet that with minimal risk, which means lower cost, and we can hold everybody accountable. I think at that point then we'll have a foundation for extraction of the best knowledge available, and to have effective and open communication. Most may not understand, just trust me a little bit. We're going to need to go through that process. And then I think the only other thing, Senator Wiklund, that I would add is that I know it has county, with in conjunction with the county, and I think the counties should be equal at the table, and that nothing moves forward without their approval, not tacit approval, not hey, we gave you an update, we updated you with an email. They are the ones that are going to have to live with this, and the costs have been borne of the ineffectiveness borne on every county in this state, and worse off, borne on every person who we deem eligible for a benefit that they receive it. And so I think it's failing everywhere. But on the procurement side, I've worked with the county people since I've arrived, and we have to do those things because I don't think we're going to be prepared to. We're going to have to utilize the process to do some of the discovery and the best extraction of the solutions that will help us solve these problems. In addition to the data, we need to make sure that we have but at the federal level and state level, I think out of the work that the steering team has to do is we have to develop clear and concise eligibility determination changes at the federal level and the state level to unify them or simplify them so they're more uniform, so we can apply even better technologies or data sources to automate as much as possible for each of the people who are doing eligibility, and let them do the complicated or sophisticated work of the error queues or resolution queues that fall out of it. So that's all I have, and you guys know I'm committed to it, and Senator Wiklund and the counties and everybody in it. We're going to have to take those steps in a very short manner. So thank you.
Other questions or discussion? I will just say thank you, Senator Wiklund, for bringing this. Clearly, there is a need. I appreciate the demonstration. It's one thing to hear about it; it's another thing to see it and to walk through it. So that is very helpful. I have just a question. You mentioned, entering like the income 4 or 5 times. In terms of SNAP, we are hearing more about the error rate. If there's a mistype, and on one of those 4 times that the worker who is, working very hard amongst all of the screens and the paper and all of these things, mistypes and enters a wrong amount, does that get counted as in the error rate? And Mr. Hilgert?
Madam Chair, that's a great question, and yes, it does. And so I should have added a 5th lens on there because the impacts of the error rate legislation that was passed in H.R. 1 in spring of last year is going to be twofold. It's going to be casework or admin-focused errors, which would be exactly what you're explaining right there. And then another portion of that, almost 50-50, client-driven errors, things that we actually have no control over. We catch, we actually remediate or charge back, garnish wages, or reduce future benefits. So the taxpayer's kept whole, we find it, and yet it's considered a client error, and we're penalized for that. You'll hear a bill shortly coming up soon that we hope you support, which says no, the state will take care of those error rates. But regardless, this is a consequential policy decision that you all will have to decide, because certainly counties don't feel that we should be bearing the fiscal responsibilities of historic shifts for these federally mandated programs. But thank you for that question.
Thank you. Senator Wiklund, closing comments.
I see Senator Port has her hand raised. And
I'm very sorry. Senator Port, my apologies.
No worries at all. Thank you so much. I just want to really express my appreciation to the counties and all of the time that they spent. Dakota and Scott spent a ton of time with me, and I know many of the rest of you have been out to your counties too to see this. So thank you for helping us understand this so that we can appropriately respond. And I also think Senator Boldon, like that point that you just made about the pressure that our counties are currently under or were currently under before H.R. 1 is about to get a lot heavier. And whatever we can do now to help to alleviate some of that pressure, to make the systems work more effectively is critical. And I know that this is not a fix everything bill. It is a let's respond right now bill. And both of those are important. So Senator Wiklund, thank you for bringing this. Really think that this is a critical need for not just counties, but for the residents of Minnesota. So thank you for this bill.
Senator Wiklund.
Thank you, Madam Chair, and thank you for all of the discussion, and thank you to all of the county and county staff who could be here tonight. I think it is really impactful to see firsthand what the work process is like. And I'll just say that this bill isn't meant to do everything, but I think it is focused on some key tactics that we can use to help make the counties and the workers' lives easier and lives better for Minnesotans. It does give the counties a stronger role than maybe they have had in terms of the steering committee and helping to guide recommendations that move forward. And that was one of the key principles for me as well, to make sure that the county has a strong voice as we move forward, working with Department of Human Services, DCYF, and Minute in making these projects happen. So thank you.
Thank you. And with that, Senate File 4719 will be laid over for possible inclusion in a future omnibus. Oh, wait, hold on. We missed a testifier, perhaps. Sorry. Is the testifier in the room? Apologies. It's okay. Many moving parts today, so thank you for your patience. Happy to have you. Please introduce yourself when you are ready and begin.
Yes, thank you, Chair Wiklund, and thank you, members of the committee, for meeting with me. My name is James Sturth. I'm an analytics consultant at the Minnesota Department of Human Services, speaking in particular in my role as a member of Minnesota's Association of Professional Employees. MAPE is a union of over 18,000 state workers across all of Minnesota's agencies, boards, and commissions. I want to thank Chair Wiklund for introducing SF 4719, which reflects the very real technology needs being dealt with at the Human Services Program at both the county and state agency levels. This is a necessity, as it's been shown by the counties. We at the state have also dealt with very similar issues, and we need a more unified IT system that covers multiple programs, communicates effectively as participants move between programs, enrolled in multiple different ones, or just changes in life circumstance. People move, people's families grow. We want a system that communicates across all programs, across all IT systems. We only have two minor concerns to bring up. We would like to focus on a larger integrated system instead of a more incremental approach. So that's one of the things that's been discussed a little bit about having all these systems speak together is critical to making this work. If we work on these separately, we will have these communication problems as these systems don't speak well to each other. And then we also want to talk about agency funding. We have concerns with pulling agency funding from agency operations to fulfill any financial obligations. The DHS has testified in the past they're operating around 3% of agencies' overall funding. This is low for the size of the agency and what programs we serve, and we really want to see the state not be continued chipped away at to fund these funds. If we want to have these operating funds, we'd like to see them just brought forth in the bill as an appropriation instead of coming from DHS's budget directly. Those are the only two things we want to bring up, but we do want to urge support for this bill and the language instructing the steering committee and the infrastructure there to integrate these systems together, and as well as including an appropriation for the steering committee itself. Thank you.
Thank you very much for your testimony. Appreciate you, and again, apologies for a little mix-up there. All right, and with that, then, Senate File 4719 will be laid over, and I will pass the gavel back to Chair Wiklund.
So, and members, now we will move to Senate File 4335, Senator Champion, and then I believe after that, then we will be taking up Senator Pappas's bill, 4187. So, welcome to the committee, Senator Champion.
Thank you, Madam Chair. Thank you to the committee. I know that you all are pretty busy, so I'm going to try to be as succinct as possible while I'm speaking. If it's okay with you, Madam Chair, if I have Commissioner Rena Moran come up and join me, as well as Commissioner Irene Fernando, so we can
absolutely
move expeditiously.
Thank you.
Madam Chair, after I make my brief comments, I would hope that Senate Council can walk through the A2 amendment that we'd love to have adopted, and I can talk a little more about that. But here's the first thing that I'll say. Again, thank you. The Minnesota African American Family Preservation Act and Child Welfare Disproportionality Act modifications is something that I believe happens a lot when it comes to any important piece of public policy. That we have a pilot project that's going on that is happening in Hennepin and Ramsey County. There's lots of conversations with other smaller counties as well as the agency. And so there's always these opportunities to improve the act so that it makes better sense. Because the main objective is for this policy to play an active role to provide families the support and services to keep families together. We believe that is very important. And I will say that this amendment reflects the work of allies, the agencies, and counties to improve the bill. And we are committed to continue the work to make modifications that help counties, the judicial system, and families and others because we want this piece of policy to be the absolute best that it can be. And with that, I would ask, Madam Chair, if Senate Council can walk through the A2 amendment, and I hope that can be adopted, and then we can hear from these wonderful commissioners who have taken time out of their quite busy schedules to be here with us tonight.
Thank you, Senator Champion. Yes, we have the A2 amendment, and Senator Boldon moves the A2 amendment. All those in favor, please signify by saying aye. Aye. Any opposed? The A2 amendment is adopted. And Ms. Hoffman-Litchie, if you could walk through the amendment.
Madam Chair, committee members, starting with on line 1.3, that modifies the definition of disproportionately represented child. It removes culture within the definition and requires that the determination be made by the commissioner pursuant to the new section 2 that is right below it, starting on line 1.12. Within this new section, 260.631, it requires the commissioner every 2 years to define what is a disproportionately affected child pursuant to certain requirements, and working with the African American Child and Family Wellbeing Advisory Council. That advisory council is required to provide recommendations to the commissioner on what the determinations should be, and requires the commissioner, if the commissioner decides to deviate from those recommendations, to provide the reason why and what data the commissioner relied on to make their determination. It also requires the commissioner to make a determination on disability and low-income socioeconomic status. Those changes are starting on line 2.23, and it follows a similar process where the commissioner makes that determination every 2 years and has to provide notification to interested parties about the determinations that are made and the definitions that are going to be implemented. Starting on line 3.16, that is clarifying the definition of neglect within the statute. The change on line 4.19 is a technical change. Paragraph C does not exist, and that language is actually moved to subdivision 3, so that clarifies that. The changes on line 5.4 and 5.5 of the A2 amendment, those require the commissioner to review 10% of the cases instead of all. And then lines 5.6 and 5.7 delete the new language and strike the old language, and then moves that language to the new paragraph E that you can see on line 5.11 to 5.17 of your amendment. Going back to lines 5.8, that is a clarifying change, saying that these are child protection cases rather than child welfare cases. And then the changes on line 5.9 to strike disproportionality is a conforming change with the repealer at the back of the amendment that is repealing the definition of disproportionality. Starting on line 5.19, this new section is clarifying and modifying the requirements for the cultural competency training within this act. The change on line 7.8 is also a conforming change due to repealing the definition of disproportionality. The change on line 8.4 is similar, and the change on line 8.32 is the clarifying change, modifying it from child welfare to child protection cases. And that change is also made on line 9.14. The change made on line 10.2 and 10.15 and 10.29 are all of the conforming changes with the repealer. And the new section 12, starting on line 11.1, the change is noted on line 11.26, and this clarifies that the working group expires at the end of 2027. The changes made on page 12 on line 12.4 extends the appropriation availability, and then the new section 15 on line 12.15 repeals the definition of disproportionality.
Thank you.
Madam Chair, the only other thing that I would say is that you will notice that we have not put in anything in particular at this time around the appropriation, because we will come back and have a conversation with you, Madam Chair, about the appropriation, because we want to make sure that we are gathering that information from counties and others in order to make sure that we have something that you can wrestle with, because I know that you have important fiscal matters. And last but certainly not least, I'll end where I started, where I started by saying that this A2 is a reflection of a lot of work that has gone into this A2, but there's always some continuing conversations just to make sure that we're doing the very best we can and getting the very best information on paper in order to benefit this program. So with that being said, Madam Chair, if we could go to one of the commissioners. They're both wonderful, so I'm not sure which one to go to first.
Commissioner Moran, welcome to the committee. Commissioner Moran, if you wish to state your name for the record and begin.
Yes, good evening, Chair Wiklund and members of the committee. I want to thank you for the opportunity to testify. My name is Rena Moran, and I have the honor of serving as the Ramsey County Commissioner of District 4 in St. Paul, which includes the capital. As a former member of the Minnesota House of Representatives, I focused on protecting children in the child welfare system. And it so happened that I first introduced this bill back in 2017. It is because of the many, many stories that, as I worked with parents who had been impacted by the child welfare system, out-of-home placement, it was through those stories that I was hearing from them about the impact that out-of-home placement with strangers was having on, the trauma that it was having on children and the families. And because of that, we began to have hearings and conversations. And finally, under the leadership of Senator Champion in 2023, we was finally able to get this bill passed, with Ramsey and Hennepin County being a pilot of the program before it becomes into law next year. So now, in my role at the county level, I am responsible for implementing it. I like to say that counties are often the ones who make the legislature dreams come true. At Ramsey County, I've seen firsthand both the potential and the need of this work and what it takes to make it succeed, including making active effort a reality in the practice of counties across the state. I would like to highlight 3 implementation considerations as you consider Senate File 4335, as we continue to improve on the work that has been done, the long, long work that has been done around this issue. First, we strongly support the proposal to transfer case reviews responsibilities to the Department of Children, Youth, and Families. Moving case reviews to the state agency is consistent with how case reviews operate in other programs. Ramsey County has already invested significant resources in this area, but the administrative burden and the financial costs are unsustainable for counties. Second, we support the appropriation of funding for our counties to implement this legislation. As an early implementer, Ramsey County has been developing the infrastructure, the workforce, and the community partnerships needed to make this dream come true. The investment has been significant. The acts require counties to fundamentally change how they approach this work. It calls for new staffing models, specialized training, increased engagement with families and community providers, and much more comprehensive data collection and reporting. These are system-level changes, and funding is essential for it to be effective, to work the way it needs to work back out in the community and to support those who have been disproportionately impacted by out-of-home placement. Third, and finally, the 2024 legislation provides $2.5 million to Ramsey and Hennepin County to help fund a 2-year implementation phase. The funding is available until June the 30th of 2026. This is 6 months before the end of the implementation phase. So Ramsey County support extending this appropriation to December 31st, 2026 to align with the full implementation phase where the work is actively ongoing. I want to thank you, Senator Champion, for authoring this bill, for your leadership, and for your tireless effort that you have done in partnership with community and those who've been impacted by the system. And I'd like to thank you, the committee, for hearing this bill today. Thank you.
And
Thank
Madam
you.
Chair, as we get ready to transition to Commissioner Fernando, I'd just like to say the three notions outlined by Commissioner Moran is reflected in the A2 amendment.
Great, thank you. Commissioner Fernando, welcome to the committee. If you can state your name and begin.
Good evening, Chair Wiklund and members of the committee. My name is Irene Fernando, Hennepin County Board Chair and District 2 Commissioner. I use she, her pronouns, and I'm grateful for the opportunity to testify in support of Senate File 4335. In 2024, with strong bipartisan support, lawmakers passed the Minnesota African American Family Preservation and Child Welfare Disproportionality Act, or MAFPA. Lawmakers showed a shared commitment to address the significant disparities in the state's child protection system, such as data showing that African American children in Minnesota are removed from their homes at rates 3 to 5 times higher than their white counterparts. 3 to 5 times. MAFPA is designed to promote family stability, family reunification, and positive outcomes for all children disproportionately represented in the child protection system. Hennepin County is proud to be one of 2 counties who are phasing in MAFPA. Starting in January 2025, we began our work to apply active efforts to a subset of families in the child protection system. So far, the results have been promising. For example, as of February 2026, only 3.8% of MAFPA phase-in cases experienced out-of-home placement. Under 4% experienced out-of-home placement. Significantly lower rate than prior to MAFPA implementation for children disproportionately represented in child protection. Hennepin County strongly supports key provisions of this bill, specifically county resources and state-level case review. First, applying the active effort standard of MAFPA requires more time and resources. Increased staffing is needed to reduce caseload size and invest in more intensive relationship-based work. MAFPA also means counties need to provide more access to concrete supports for families, such as housing assistance, transportation, childcare, and other basic needs. We strongly support the resources that the bill invests in counties to help offset these important expenses. Second, this bill shifts case review to the state level. Case review at the state level ensures greater program efficiency, cost effectiveness, and community consistency, versus requiring all 87 counties to conduct separate review processes. We also appreciate the technical change to align the resources for the phase-in with the actual phase-in timeline. In closing, Senate File 4335 bolsters the ability of counties to successfully implement MAFPA in 2027. Thank you to Senator Champion for your leadership on MAFPA overall and your authorship of this bill. And importantly, I extend sincere gratitude to county staff and community providers who engage directly with children and families every single day. noting that staff are available for program questions during member discussion. Thank you, Madam Chair.
Thank you. And now I have a few more testifiers that are listed. I have Commissioner Carla Bigham, and then if I could also have Stacy Hannon come to the table.
Good to see you.
Welcome to the committee, Commissioner Bigham.
Thank you, Madam Chair. Always good to see you. Good evening, Chair Wiklund and members of the committee. For the record, my name is Carla Bigham. I'm the chair of the Washington County Board of Commissioners and former legislator. I'm here today representing the Association of Minnesota Counties, AMC, and the Minnesota Intercounty Association. I am here today in support of Senate File 4335, legislation that addresses resourcing of the Minnesota African American Family Preservation and Child Welfare Disproportionality Act. And I really, truly want to thank Senator Champion for his leadership on this issue. I also want to give a shout out to Ramsey County Commissioner Rena Moran and Chair Irene Fernando from Hennepin County for their leadership on this issue and their staff's leadership on this issue. The state agency is best positioned to conduct case reviews as is called for in the Act. This is in alignment with existing models such as CFSR, an existing federal audit structure. Counties also support a representative sample size being determined for the case reviews. And I know that was reflected in the amendment, Mr. President. Counties want to be strong partners in ensuring the integrity of the work, working alongside the state to support continuous learning and improvement while strengthening practice and alignment with the Act. In addition to the case review function change, it's imperative that the legislature invest in the services and staffing that make this work. Services and staffing investments are critical to supporting active efforts. We must balance efforts and change the practice of that the Act initiates. Successful implementation of the Act is at risk if the legislature doesn't make the necessary investments and adjustments, including in Senate File 4335. We must make sure that the culturally responsive and prevention services are available to support active efforts. We must also pay close attention to our county-based workforce. They are a critical and necessary component of implementation. We need to ensure that we can attract and retain talented staff, manage caseloads, and prioritize their time being spent with families, not conducting administrative functions. And we also must balance the bureaucratic and administrative components of the Act with investing in services and support to families at a local level. So in closing, on behalf of AMC and Micah, we urge your support of Senate File 4335. Thank you.
Thank you very much. Ms. Hannon, if you could please state your name for the record and begin.
Good evening, Chair Wiklund and members of the committee. I'm Stacy Hannon, the Executive Director of Western Prairie Human Services, consisting of Grant, Traverse, and Pope counties. Thank you for the opportunity to provide testimony on Senate File 4335. I'm speaking today in support and from the perspective of county child protection administrators in Minnesota. Counties share the legislature's commitment to ensuring that Minnesota's child welfare systems operate fairly and equitably, and that all children and families have access to services and supports that promote safety, stability, and well-being. Counties recognize that disparities exist in many public systems, including child protection, and we support efforts that improve transparency, strengthen data analysis, and help identify barriers families face when interacting with public systems. At the same time, it is important that policies addressing disproportionality are implemented in ways that strengthen the child welfare system and recognize the operational realities of Minnesota's state-supervised, county-administered structure. It's critical that administrative functions are balanced with investments that serve and support families. First, counties support the statewide review and analysis functions within MAFBA-CWDA, becoming the responsibility of the state. Having the commissioner conduct these reviews will allow for consistent data analysis and a broader understanding of trends across jurisdictions. This type of statewide analysis can help identify systemic barriers, service gaps, and opportunities for improvements that may not be visible when examining individual counties. Furthermore, the findings from the case reviews should inform statewide policy discussions, service development, and collaborative system improvement efforts. The purpose of these reviews should be system learning and improvement versus punitive oversight. The goal is to improve our system as a whole and identify areas of strength and opportunities for improvement. It's important to recognize that county child protection agencies operate within a framework defined by state statutes, court decisions, service availability, and community conditions. Many decisions affecting case outcomes, including permanency determinations, court orders, and service accesses, are influenced by factors outside the direct control of county agencies. Second, addressing disproportionality requires more than data analysis. It requires meaningful investment in prevention services, culturally responsive supports, and workforce capacity. Counties frequently encounter families facing complex challenges relating to housing instability, untreated mental health needs, substance use disorders, and limited access to community-based services. These conditions often contribute to the very disparities the system is seeking to address. For disparity reduction efforts to succeed, policy expectations must be aligned with adequate and sustainable resources. When legislation contemplates remediation plans or system improvement efforts, counties must have the tools necessary to respond. That includes investments in prevention programming, culturally specific providers, family preservation services, and staffing capacity. Without these supports, counties may be asked to address deeply rooted systemic challenges without the resources needed to produce meaningful change. Third, outcome disparities must be examined within the broader context of community conditions and system structures. Child welfare outcomes are shaped by numerous factors that extend beyond county agency practice. Poverty rates, housing availability, access to treatment services, transportation barriers, and court processes all influence the trajectory of cases and the outcomes families experience. Evaluating disparities without incorporating these contextual factors risks attributing complex social outcomes solely to local agency decision-making. Data analysis should instead be used to illuminate where barriers exist across the system so that policymakers, state agencies, courts, and counties can work together to address them. Minnesota counties are committed partners in strengthening the child welfare system, ensuring child safety, and improving outcomes for children and families. Statewide analysis of disproportionality can be an important step toward that goal if it is structured to support collaboration, shared learning, and system-wide improvement. As the legislature considers Senate File 4335, counties respectfully encourage a framework that preserves Minnesota's state supervised county administrative structure, ensures that expectations for improvements are matched with sustainable funding, and evaluates disparities within the broader community and systemic context in which families live. I thank Senator Champion for his leadership on these issues and for the opportunity to provide input on this legislation. I would be happy to answer any questions.
Thank you. And I have one more testifier, Commissioner Kurt Mortensen. Welcome to the committee, and if you can state your name for the record and begin.
Good afternoon, Chair Wiklund and members of the committee. Thank you for the opportunity to testify in support of Senate File 4335. I also want to like to thank Senator Champion for his leadership on this issue. I'm Kurt Mortensen. I'm an Otter Tail County Commissioner. Today I represent the Association of Minnesota Counties, AMC, the Minnesota Intercounty Association, MICA, and also Otter Tail County. Just briefly, before becoming a commissioner, I was an attorney in the Otter Tail County Attorney's Office, approaching 30 years, where much of that focus centered on child protection. I come here with a lens as a practitioner in the system, as a prosecutor, and now as an elected official. All who I represent here today support Senate File 4335, legislation that unites all 87 counties by resourcing the Minnesota African American Family Preservation, Child Welfare, and Disproportionality Act. As you have heard, counties have been routinely expected to make up funding shortfalls and fill gaps in service delivery. Our only real means to meet these expectations is through levy increases. But county cost shifting exacerbates inequities and limits our abilities to innovate and invest in evidence-informed practices such as family resource centers. Over the past 3 years, Otter Tail County has worked with local communities to assess and launch family resource centers within our county. Research from Chapman Hall and studies from other states show that supporting families through early intervention, it stabilizes and strengthens families and lessens child welfare involvement. Though more research and analysis is underway, we have looked to Scott County, where their family resource centers have shown reductions in child support interventions. 4 years of data from Scott County demonstrate an approximate 40% reduction in child protection assessments, investigations, and out-of-home placements. Scott County's FRCs also meet diverse community needs, with 70% from underserved communities. I share this update because Otter Tail County is proud of our significant process toward developing family resource centers to strengthen families and communities. FRCs are one example of programming that align with the purpose of MAPFA WDA, family preservation and improved outcomes. Our shared goal is a successful rollout of this legislation. Successful implementation requires investment in local services and support. Building stronger relationships with families not only requires investments in services and support, it also means reducing case ratios. We urge you to let counties focus on supporting children and supporting families and not get stuck in the administrative function like case reviews. For these reasons, it's critical that the state complete case reviews required by this legislation. In closing, on behalf of AMC, Micah, and Otter Tail County, we urge your strong support of Senate File 4335. Thank you, Madam Chair.
Thank you. Thank you very much for your testimony. Members, do you have questions or comments about the bill? Senator Curran.
Thank you, Madam Chair. Senator Champion, so we're moving the casework off to DCYF, and I see there's a note that you plan to fund it.
Senator, can you speak more into your mic because I'm having a hard time hearing you?
Yeah, Senator Champion, I share with you these. These committee rooms are terrible. All the noise in that vestibule are terrible for us as well as you. Mm-hmm. So, in the moving the casework to the state to DCYF, and it looks like you plan to fund them to do this work.
Madam
Senator
Chair
Champion.
and Senator Curran, yes, we've had lots of conversations, and we'll continue to have additional conversations about the act in general. But the case reviews, you've heard from a number of different counties how they thought the best entity in place to look at the case reviews would be the a state or the state agency, and so that's what we have in our amendment is for the state agencies to look at those case reviews, and then there would be some progressive number of reviews that they will do as well. So we heard that, and we are committed to continue to work on that.
Madam Chair?
Senator Curran.
Yeah, Senator Champion, yeah, we understand that's where it's going, but you plan to fund it. And do you plan to fund and grow the state agencies and provide them with the appropriate staff? And do you plan to bring an amendment forward to fund the counties for the remaining portion that isn't funded?
Senator Champion.
Madam Chair and Senator Curran, you're out in the hallway, I'm sure, doing some constituent business, so you didn't hear my presentation earlier about that. Yes, there is a blank appropriation at this time because we're collecting as much information from the counties as possible. We have also talked to the agency. We're thinking about the mechanism that we'll use in order to help counties look at staffing and how they pay for the active efforts that this bill calls for. So, yeah, we have a real commitment to that. In fact, we do not want the counties to have to take on unfunded mandates. We heard earlier before I sat in this seat how H.R. 1 is requiring the counties to do all sorts of things that they didn't originally do that is going to cause an enormous burden on them. So we're committed to doing our absolute very best. We know that our resources are limited, but we're going to do our very best because we recognize the importance of the counties as a partner. And we will continue to do that. So, yes, there will be an amendment for that. In fact, this bill is going to be laid over for possible inclusion. There will be some additional work that will be done just to make sure that we have the best presentation forward that includes resources.
Madam Chair.
Senator Coran.
And Senator Champion, so we have limited funding, right, in this year because of a collection of issues and costs that the burdens that have been placed on the state of Minnesota since '23. So when we have a shortage in funding, who's going to get the majority of the funding? Who will you short? The counties or the state agency who will take on this new work?
Madam Chair and Senator Coran, one thing I've always learned in my profession, and I'm sure the other lawyer that's sitting here will tell you, that we don't like to speculate, right? We like to make sure that we have a solid plan as to what can or cannot happen. We respect the work that is required on the state level as well as on the county level, and we're going to do our absolute very best to resource the folks who need the resources in order to implement this important piece of policy that helps families. Because at the end of the day, we often talk about families being very important and keeping families together. So we're going to do our very best. And because I think you're so interested in this, I think you're going to help us do that.
Senator Coran.
Does the casework, somebody can help me out on this particular casework and review, does it require participation from the families in the cases that are being reviewed?
So I'll let the county answer that, but I'll take my first stab at it, Madam Chair and Senator. Case reviews are those cases that the state reviews. So there will be a percentage that will be randomly chosen from that particular county or a particular county in order to see what are the practices and the best practices. But you are reviewing what was done in that particular case. So maybe I will let my phoner friend have.
Madam Chair, maybe I can simplify the question. Is it purely an administrative task, literally an administrative task where you don't need participation from the family in person?
Ms. Hennon.
Chair Wiklund and committee. So as of right now, our understanding of the reviews is that they will involve a multitude of things. I think that some of the details are still being figured out. I do believe that they are primarily paper reviews. I don't know that they are going to involve in-person interviews with families, but that's still under discussion. I would think that Hennepin and Ramsey could speak to how they're doing their current reviews. That would be they could certainly talk to that. But as of how they're going forward, we're still, the statewide work group is still having conversations about that.
Madam Chair, thank you.
Okay. Senator Utke.
Thank you, Madam Chair. And just to follow up on kind of some of those questions that were being asked and comments that I heard, I guess, first of all, with the proposal in this bill of bringing some of it to the state, what's the division between what's being left at the counties as an unfunded mandate and versus what the state's picking up? I did hear we will do our best to cover some of these costs. I think our counties have heard that before, and they're pretty leery when we tell them that, because this bill in its original state has been a huge, huge burden to our counties as they've been looking to put this into play. It's just extremely expensive. A lot of our small counties, I mean, it's a 10% plus increase in costs. And so we're hearing that some of this cost is going to be shifted, but I really would like to know, and I know that they even want to know more so, is what's going to be left at the county in this unfunded mandate. And, we may not have those numbers here, but if it's being left over, or laid over, excuse me, that we hopefully will get those. And at the same time, maybe, Madam Chair, a local impact note or something that would help identify what's the remaining cost that's going to be left back in the county level. So I'll stop there for right now and see if you've want to add a comment or a reply.
Madam Chair and Senator Utke, let me take a stab at this, and then if there's another county person that wants to speak there, certainly capable of doing that. So the first thing, case reviews are being shifted to the state in their entirety. The percentage of cases that the state will look at is under review. Because we heard from the counties that was an enormous task for them. So just so that you are clear, Senator Uckey, when you hear me say that we're going to do our absolute very best, is because I believe we should always strive for perfection and that we should always strive to do our best. So I hope that's not where you stop listening, but you all also heard me say that the case reviews shifted to the state. The question becomes, how many of those cases will be reviewed? Will it be 100%? Will it be 10%? Initially, it's going to be 10% from each county, and that work will be done by the state. So I think, if I'm correct, that you should feel good about the fact that that will not be an unfunded mandate. But if we're looking at unfunded mandates, we certainly should think about the federal government, and we should certainly think about all the work that the counties are going to have to do for work release and work requirements for those who are 18 to 64 that is going to fall on the state, and how they got to do them much more consistently. So if we're really concerned about that, I think we should holistically think about how we make sure that the counties get the resources that they need. And I'm quite sure, Senator Uckey, that you sent a letter to the federal government to say that our counties should not be burdened with those responsibilities without resources.
Senator Uckey.
Thank you, Madam Chair. And I am concerned about the unfunded mandate of this, because our counties, I can go down quite a list, but the ESST, paid family medical leave, that we dump this on them, they're struggling with all these costs. So I'm hoping that in the end we do have a chance to really address this with them, because they don't have unlimited resources. Every dollar they spend, we should see in our tax statements. And in fact, I saw that my tax statement showed up yesterday at my house, so I'm sure there's going to be a lot of people quite concerned when I get home this weekend. So anyhow, I do appreciate this, and I hope the work continues so that we can reduce some of that burden on them, but I hope that it even gets to be less of a burden to our counties. So thank you.
The one thing, Madam
Senator
Chair, that I
Champion.
say that I think will help Senator Uckey and the others around the table is the one thing that we've really strived to do is be partners. We've tried, and we are always striving to be partners so that we can recognize what is needed on a county level, on the state level, because whatever is needed on those levels, we are looking to benefit families. That's the main driver. So thank you, Madam Chair, for your patience.
Yeah, no, thank you. Any other questions or comments? Senator Kupek.
Thanks, Madam Chair. I'll just be very quick. I just want to thank Senator Champion for bringing this. I know when I met with the counties, this was high on their agenda to get some funding and to find a fix for this, and I'm really thankful that you've picked this back up and are working on it and as partners. So thank you for that.
Thank you. As was stated, this bill will be laid over. Any final comments, Senator Champion? Or no?
Final comments. Again, thank you so very much. I want to thank the counties. I want to thank the state. I want to thank everyone who has leaned in order for us to deal with this very complex and a very anxiety-filled proposition, right? Because it's something that we haven't done. But guess what? History is always made by those who lean in order to do something that some people deem impossible. But it is possible, right? And so I want to thank everyone for that. I also want to thank Village Arms, Khalees Houston, who's not here. I know that she struggled a long time in order to make sure that we could do this important work, along with Representative Rena Moran, that she was right, that she was the first to carry this bill and really worked hard. And then she left it for me, and I've been pulling my hair out ever since. So I'm certain that you know that this is work that is necessary. So thank you to you, to you, Madam Chair, for just hearing this bill tonight, and I look forward to us wrestling over the resource part of it all. Okay, thank you so very much.
Thank you, Senator Champion. And Senate File 4335, as amended, is laid over.
Thank you so much.
And now we will move to Senate File 4187, Senator Pappas.
It's so noisy.
If folks could take your conversations, please, out into the hall. It's really hard to hear otherwise.
I don't being so noisy.
Senator Pappas has Senate File 4187, and I just want to make a comment. There are photos in the handout that I'm just giving you a little ahead of time warning that if you're not interested in seeing more graphic photos, please don't turn to the last page, is what I understand. So, Senator Pappas.
Madam Chair, I actually don't have a copy of that. I don't have the black and white version, but I did request that they make color copies.
They are color copies, yes. Senator Pappas.
Thank you, Madam Chair. Senate File 4187 is a bill that attempts to bring some enforcement teeth to existing state law. The Infectious Waste Control Act and current law requires generators of infectious and pathological waste, including blood and body parts, to segregate that waste from their general trash and send it to facilities that are specifically licensed to manage infectious waste. Unfortunately, that does not always happen, and infectious waste is getting mixed in with general municipal solid waste and sent to our local waste management facilities. This puts facility employees who process and sort that trash at risk for infection from blood-borne pathogens such as HIV and hepatitis. It also adds unnecessary trauma and stress to an already challenging job. Current enforcement efforts have failed to curb the problem, and that's why I'm bringing this bill forward. The bill addresses the problem in 3 ways. 1, it requires regular audits of infectious waste generating facilities, such as hospitals and clinics, to confirm that they're following the waste management plans they're required by law to have. Second, the bill increases the fines that are assessed against a generator for failing to properly dispose of their infectious waste. And we are certainly open to discussions about the fine amounts, which level is necessary to keep infectious waste from being illegally disposed of, but the current fine structure has not been enough of a disincentive. Finally, the bill provides funding for training and materials on how to properly dispose of infectious waste so generators can have a clear understanding of what is expected of them. Members, this is a system-wide problem that is not isolated to 1 or 2 bad actors. Stronger enforcement is clearly necessary to demonstrate that we expect compliance within Minnesota law. I'd like to now hand it over to Washington County Commissioner Carla Bingham to describe the impact on the Ramsey Washington Recycling and Energy Center in Newport.
Thank you, and welcome back to the table. Commissioner, please state your name for the record and we can begin.
Thank you, Madam Chair. I'm still Washington County Commissioner Carla Bingham, and I have the privilege of sitting on the board of Ramsey Washington Recycling and Energy, which is a joint powers board comprised of commissioners from both Ramsey and Washington counties. This concern we are working to address with this bill is not a single rogue needle or a tissue from a bloody nose. We're talking about blood and body parts that are liquid, squishy, and moist. There's a collection of photos, as the chair alluded to, in your packet that showed just a small sample of the sorts of infectious waste that come through the R&E Center in the past 3 years. Ultimately, we do not need our tipping floor looking like Ed Gein's freezer or barn or Jeffrey Dahmer's kitchen. This is a worker safety bill, and we are committed to our employees' safety and well-being. Our employees, IBEW workers, do not deserve to be exposed to potentially life-changing diseases or have to suffer from PTSD from being confronted with this material. We need this waste to stop coming into our facility. We thank Senator Pappas for carrying, the legendary Sandy Pappas, for carrying this legislation, and we are hopeful that increase in penalties, oversight, and training will help solve this problem so that our incredible R&E staff can be safe in doing their jobs, managing our municipal solid waste. We are open to working with the MPCA and the Hospital Association to find a regulatory fine and framework that works for everyone and stops this waste from impacting our employees. With that, I'd like to now, Madam Chair, with your permission, turn it to R&E employee Sean Donovan to talk about his experience dealing with this infectious waste.
Welcome to the committee, Mr. Donovan. Please state your name for the record and begin.
Good evening, Madam Chairman. My name is Sean Donovan. I'm a 20-year employee of the Recycling Energy Center, 12 of which I've been a local union steward for IBEW Local 23. I'm here to talk today about the infectious waste that has been coming into our plant. It has been a problem here and there my whole career, but as of Memorial Day 2023, it has gotten out of control. And I'm not talking about a few bandages or bloody rags here and there. Now I'm talking about IV tubes full of liquid blood, sharps, containers full of blood and God knows what, flesh, organs, body parts. And this is unacceptable for myself and the guys I represent. We do use heavy equipment at the plant, such as front-end loaders and grapple cranes, but at night we physically go in, clean all the equipment by hand, or essentially by hand. We have the proper PPE for what we normally deal with, but to throw that infectious waste, such as I described, into the mix, we are not protected or set up for that. One of my biggest fears is to hear of one of our guys getting splashed with blood or such, poked by one of those needles, contaminated with who knows what, and what effect that will have on the employee and his family. We also unfortunately have plugs on our processing lines every so often, and this requires us to get in there and remove the plugs by hand. Excuse me. These aren't just a few pieces of trash plugging up the lines, but could be and are sometimes hundreds of pounds of raw garbage. Not the most glamorous part of the job, but it is what it is. To have a guy in one of those lines doing his best to get the job done safely and quickly, coming face to face with, well, part of someone else's face or other body parts, I don't think I really need to elaborate on what that could do to an employee's mental health, let alone their health in general. The infectious waste coming in to our plant comes in two different ways, both of which cause their own problems. One is directly from the generator. I'm not talking about just hospitals, but surgery centers and even little day clinics. We are informed that their loads are coming in and we can visually inspect those loads after it's dumped onto our tipping floor. If we do see something, it gets reported right away, and we bring in outside contractors who are trained and equipped to sort through and isolate the blood and guts and remove it. The rest of the load is then sent to a landfill. This is extremely time-consuming and adds another safety risk on our tipping floor that already has front-end loaders, small haulers, and large semi-trucks with trailers going here and there. The second way the infectious waste is coming in is on transfer loads, where it is extremely difficult to identify as mixed in with tons of regular garbage. And our guys are pretty darn good at identifying hazards going up the lines, but if the infectious waste is hidden in black garbage bags, which happens, who knows what's getting missed. Bottom line, Senators, is we need your help, and this piece of legislation, to me, is the best option we have right now. I don't need to hear about, we have a new guy, he must have messed up, or, well, we brought in a new janitor service, it's getting straightened out, just be patient. I've heard this for years. When I took the job at the plant 20 years ago, I was hesitant to take the job because it's gross, it smells, and it can also be very dangerous. I didn't sign up to deal with blood and guts, nor did any of my coworkers. I encourage all of you to please come down, take a tour, so you can see firsthand what is going on down there. Our tour people are pretty awesome, just saying. And thank you for your time and attention to this. If you have any questions, I'd be happy to answer them. Thank you.
Thank you. Thank you for your testimony. Now I have Sam Hall and Michelle Benson. Welcome to the committee, and please state your name for the record and begin.
Good evening, Madam Chair. My name is Sam Hall, and I'm the Facility Director at the Ramsey Washington Recycling and Energy Center. The R&E Center processes about 1,800 tons per day, which is enough to fill up a football field with 6 feet of garbage. And I'll also remind this committee annually that processes 14% of the state's waste, including the waste from the Capitol. And as a material recovery facility, we operate as a public health and environmental health extension of the two counties to divert material from landfill, make renewable energy, and recover recyclables out of the trash. And if we wouldn't do that, all of the waste that we would be, or in the two counties, would be going to landfill. When an infectious waste load comes in, as Sean mentioned, it takes up space on our tipping floor, and that's probably the most dangerous spot for our contractors, our haulers, our employees. And then I'm bringing in specialized contractors to sort through 8 tons of mixed municipal solid waste to sort out the improperly disposed of infectious waste. And those are hand-sorting individuals that we have front-end loaders, we have garbage trucks, we have semi-truck and trailers operating in the same space. And when we have a load quarantined on our floor that's taking up space that then contracts the rest of the operating space. I've also personally donned PPE to go out there and verify infectious waste. And I will say our definition of infectious waste meets the same definition of infectious waste for the MPCA and for the hospitals and clinics that operate in the state. Every incident at the facility has been documented, and we have sent notifications to the MPCA and to the generator. I have spent the last 3 years working collaboratively with the MPCA, the Minnesota Department of Health, and the infectious waste generators to solve this problem. It hasn't worked. Since September 2023, I have documented 183 separate events where I've verified infectious waste. And the importance of me verifying the infectious waste is that each time I call up that contractor, it's $5,000 to $7,000 of manual labor to sort through that waste. In the end of my job at the end of the day is to keep my employees safe. We have 74 IBEW Local 23 that operates that plant 364 days a year with the goal of an environmental impact to divert material from landfill. These employees deserve an opportunity to return to the next day without the stress and risk of a preventable injury, and their family deserves that as well. And I'll end with this. The definition of insanity is doing the same thing over and over again and expecting different results. Since I've been working to fix this issue, we have not had different results, and we have not tried anything different. This is why this legislation is being introduced, because I've been dealing with this for 3 years. The system is broken. Thank you.
Thank you for your testimony. Ms. Benson, if you can please state your name for the record and begin.
Thank you, Madam Chair. My name is Michelle Benson, and on behalf of the Minnesota Hospital Association, our 139 hospitals and health systems across the state, we respectfully oppose Senate File 4187 as currently drafted. Minnesota hospitals share your commitment to protecting public health, keeping waste management workers safe, and ensuring the responsible handling of infectious waste. Our facilities operate in highly regulated environments under MDH, MPCA, OSHA, CMS, Joint Commission, DOT, and the CDC. We already maintain extensive policies, staff training, and compliance systems to prevent improper waste handling. Even with strong training and compliance systems, mistakes can occur in busy clinical settings. In the case of a mistake, the generating facility, in this case a hospital, pays for the cost of cleanup at the Newport facility. Additionally, the MPCA has the authority to fine a generator and impose corrective action. Hospitals, in cooperation with the MPCA, are continually improving our infectious waste management. In your packet is a list of claims of infectious waste received at the Newport facility. This hasn't been verified by the PCA and not necessarily verified by the medical facility listed. A number of the facilities on this list did not receive a complaint, a request for a cleanup, or communication from the MPCA. The gap between the information on the list and the corrective actions needed to be taken demonstrates the importance of improved communication, documentation, and process resolutions. We are happy to work on those issues. A significant note, the report lists 106 apparent incidents in 2023 and a significant reduction to 28 apparent incidents in 2025. The regulatory structure that has resulted in fines for some facilities is reducing mistakes toward a shared goal of keeping infectious waste out of the solid waste system. With documented progress, an inordinate increase in penalties that is included in the bill seems out of line. As we look to the bill and review the languages on lines 2.6 through 2.15, the parameters of $200,000 to $2 million in penalties seem unclear to us. If a hospital has 3 violations over a 10-year period, or a 20-year period, or a 30-year period, are they subject to a fine of $2 million? On lines 2.14 to 2.15, they would also be subject to undefined sanctions by the Minnesota Department of Health against their license. I ask the members of the HHS committee to review the scope of commissioners' action against a hospital license. The language, as written, would require a hospital to be perfect over an undefined period of time or face extreme sanctions, including sanctions against their license. In addition to extraordinary fines on lines 2.13 and 2.16, the bill requires MPCA to send half of those fines to the receiving waste management facility. We are not aware of any other area in statute where state law allows penalties of this magnitude or the requirement to share fines with the reporting entity. We all want a system that protects workers, the environment, and public health. But Senate File 4187, as written, could unintentionally harm the very hospitals Minnesotans rely on. We urge the committee, the authors, to work with us with the MPCA to ensure due process, align consequences with regulatory construct, and we will happily work with waste management partners and regulators on balanced solutions that strengthen safety without threatening access to care. Thank you, Madam Chair and members.
Thank you. That concludes our testimony. Members, this bill, as you can see, it came from the original jurisdiction was in the Environment Committee. We're hearing it because it has to do with hospitals and the impacts on hospitals, and that's what we're discussing today. And the fact that it involves the Department of Health. So, members, do you have any questions or comments about the bill? Senator Utke.
Thank you, Madam Chair. And my question I'll start out with is for the, I don't know if it's a transfer station or wherever they're bringing this in. Looking at, I guess my first question is, it's arriving in a garbage truck, a compact packer, right?
Madam Chair? Senator, yes. Waste
Hall.
arrives.
I'm sorry, Mr. Hall, go ahead.
Waste arrives, so the 2 counties have what's called waste designation because we're publicly owned and operated, and we partner right now with 5 transfer stations as satellite collection locations. So either a hauler truck that starts at a hospital will either come directly to us or go to a transfer station where it's consolidated into a semi-truck.
Senator Utke.
Thank you, Madam Chair. But even if it starts at a hospital, it may be picking up a dumpster or 2 full, but it then is adding to its load throughout the process with other stops, correct? Because, I look at the sheet that's supplied here and I see a whole lot of dates that are the same, a lot of different facilities, but how do we know when it comes in a compact load where it came from?
Mr. Hall.
Madam Chair, Senator, the first thing that is that it's identified as of infectious waste. That starts a whole different process. Whether or not I know where it's coming from, I have to properly dispose of it. The second thing is that there's a chain of custody. So we have scale tickets for every vehicle that stops at a transfer station or at our location. That truck has then a bill of lading, per se, that I can trace that back, or the hauler, we notify the hauler that says, hey, where did that truck come from? And there's 2 different ways to trace that back. Either it's a multi-stop route, so it's picking up at multiple locations, or it's a compactor that's coming from an individual location. Now, the fact of the burden of proof, that's with the MPCA. They're the local government authority for investigating where this came from. I can tell you like one of 5 locations it came from, but the fact is it's infectious waste, and I have a list of characters that it could have come from.
Senator Utke.
Thank you, Madam Chair. Is someone here from MPCA?
Senator Aki, you have a question?
Yep, thank you, Madam Chair. I would, because you're getting brought into this as far as basically identifying where this came from and such, I mean, how are we physically gonna know that the truck's got a lot of stops on it? I don't care where it comes from, it's gonna have multiple stops. And we're proposing some tremendous fines, and I don't see any due process in here. How is that gonna play out so that if somebody did add to this load with something that they weren't supposed to, how are we gonna get back to the actual party that's responsible?
And if you can please state your name for the record and answer the question.
Thank you, Chair and committee members. For the record, my name is Kirk Kadelka. I'm Assistant Commissioner with the Minnesota Pollution Control Agency. So this would not take away any of the due diligence process and investigative authorities that the agency has, and we have already been able to move forward a number of these enforcement cases and been able to identify specific locations. We have already, there are 5 of them that are already public information. We have a number of them right now that I cannot get into details because they're non-public, but in general, we're able to track them down. Maybe there might be other materials in that same bag. The work that's being done in investigation, for instance, that has been done at Ramsey, Washington, or the consultant and the evidence there can tie it back. If for some reason we cannot, because there is maybe multiple facilities or that would mean that the agency couldn't move forward with the penalty. So the authorities already exist for the agency to do that due diligence, make sure that we have data saying that this is the person that the penalty is being assessed to, and a process to move forward with.
Senator Radke.
Thank you, Madam Chair. What is the MPCA currently doing to work with the various facilities that are being named on these reports as far as they're suspected of being shipping this infectious disease stuff? What's currently happening? I mean, currently, do you visit with them? Does somebody talk to them? We go, we can't do this. I mean, has there been a process over the last couple of years, or are we just complaining about it and there's nobody connecting the dots?
Mr. Kadelka.
Chair and committee members, there are staff that are working on compliance enforcement cases. In our compliance enforcement cases, we look for corrective actions. So I'll speak to those current ones that have been closed. We did have them go through and make changes to their management plans and put other materials in there. We do have some information, some guidance sheets on our website to be able to help provide generators with that information, but we do not have the staffing power to go out and do more education outreach. As the bill notes, that would also help create additional fact sheets and materials that we could share with individuals and try to do proactive efforts to reduce this on the front end.
Senator Radke.
Thank you, Madam Chair. I guess a comment, and it's a little bit off the cuff, but we're not able to work proactively to work with the providers that are shipping this possibly to solve the issue, but we would have time to issue a penalty and then go this route. I guess I'm not happy with what I'm hearing there. It's like, I want to know how much are we really working with, these are a variety of hospitals and such, and I'm just seeing some tremendous fines that are, to me, unreasonable. Number one, we don't want this in a waste stream in the first place, but I don't see why something can't be worked out. I mean, I'm sure they're not wanting to do this illegally. It's ending up there somehow, but to me, usually conversations and negotiations and working with them accomplishes a whole lot more than threatening them with fines. So let's see once where I was. I guess I'll stop at that point, and I just have a really huge concern with the fact of the size of these fines, and I don't believe it's been worked through and the conversations have been had. So thank you, Madam Chair.
Senator Pappas.
Madam Chair, I think that Commissioner Bingham could address that. There have been conversations going on, Senator. But it really did take this bill and this fine level to get people's attention that this is a serious problem that needs to be addressed. And it seems to me that it is the hospital or the surgical center's responsibility to make sure their employees know what infectious waste is. There is already a law that it's illegal to do what they're doing, so they're already breaking the law. And so, yes, having audits and having training, all that's really important, but how much should the state be responsible for that? I mean, it is the hospital or the surgical center that's generating the infectious waste. And as a responsible entity, they should be able to figure out how to responsibly dispose of it.
Senator Atke, you were done. Did you have more?
I was going to be done. I just would have a follow-up to that. That actually goes back to with the waste. Is this waste being incinerated or landfilled?
Commissioner or
Madam
Mr. Hall?
Chair, Senator, both. And so we have it's an industrial processing facility. Our goal is to make refuse-derived fuel that gets sent to Red Wing and Mankato to produce renewable energy. However, our facility is not permitted to handle infectious waste, nor is the waste-to-energy facilities. And so, and thirdly, the landfill is not permitted to accept infectious waste either. There's specialized facilities where this is a separate waste stream and managed separately. And so, as far as where it goes, yes, we try to move as much up the waste hierarchy as we can, and so I hope that answered your question.
Infectious waste landfill,
Senator
I
Atke.
do have one more follow-up now, and I appreciate that. Now, if somebody had the infectious waste and they had it and contacted you, do you have the ability to handle that if it's properly handled, properly contained, or it has to go to some totally different source to get rid of it?
Mr. Hall.
Madam Chair, Senator, it goes through a separate facility. Let's say, for example, Stericycle in Egan. They are licensed to manage the red bag waste or the infectious waste stream, and it's sent through an autoclave process where it's a high-temperature dishwasher per se, and then it kind of disinfects the bloodborne pathogens on those items, and then it's disposed of properly.
Okay. Thank you, Madam Chair.
Yeah, thank you. Senator Boldon.
Thank you, Madam Chair. Thank you, Senator Pappas, for your work on this. This was not an issue that I was thinking about until this bill came forward. It sort of struck me in the beginning of our hearing, or beginning of this bill, sort of a warning about, for us to, not look at the pictures if you're squeamish or whatnot. It strikes me that is, us just looking at the pictures to where I think, and thank you for being here to testify. It strikes me that it's an entirely different thing of, folks coming into contact with this who are not expecting it. That shouldn't be happening. And so I also appreciate the comments about, like we've been doing the same things and we're getting the same results. Like clearly it seems it is time to do something different. My question is, so this is currently illegal, and it sounds like there currently are fines. How much are the current fines for this?
Senator Pappas or Mr. Kudelka? Mr. Kudelka.
Chair and committee members, for the record, again, Kirk Kudelka with the Minnesota Pollution Control Agency. So the agency has limits on violations today for solid waste and hazardous waste. And I'm just going to pull up the number real quick here. So for solid waste violations, it is not more than 15,000 per day of violation, and for hazardous waste, it's 30,000 per day per violation.
Senator Boldon? No. Senator Kupek.
Thank you, Madam Chair. I'm just kind of looking at this data sheet here of the infectious waste received by location. And I'm just wondering, is this just a snapshot? Or it says 2023, but is like September just a really bad month? Or is that just, I would, think there'd be a normal distribution curve across the year as opposed to like, wow, I don't want to be at this place in September.
September was really bad.
Mr. Hall?
Madam Chair, Senator, so the two counties have owned this facility since 2018. And before the counties owned and operated the facility, waste was not required to come there. We had been, as Sean had mentioned, this facility had been dealing with this for years. And as far as in my current role, that's when we started documenting it with the goal of compliance. my goal isn't punitive. My goal is for the safety of my employees. And that's when we were dealing with that, and it was just gross. It was 6 days a week. I was on the tipping floor. I pushed my engineering consultant to the brink. Almost lost a good employee just because he was fed up with dealing with infectious waste. The counties, no one had been trying to fix this, and I was a passive receiver, and what am I supposed to do? No one knew. And it was a struggle to get it. So that 2023, it had been happening, but that's when I started taking the documentation seriously on getting this corrected. And that's what our, regulatory compliance, there's not a gray area. It's you meet the requirement. And that's what our goal is.
Senator Kupek.
Sure. Yeah, and I understand all that. I guess I was just expecting it to be distributed a little more evenly, or if it was just like it just seems they come in these weird fits and spurts, and there's certain months of the year where it never seems like anything came in. So I was just wondering why the disparity. I mean, believe me, I do not want this infectious waste being exposed to this, but I'm just curious. It just seems odd.
Mr. Hall.
Madam Chair, Senators, I've dealt with OSHA complaints, union grievances. This really is driven, where we're at today is driven by our employees. And we're not the waste police. I'm not there to dig through every bag, but they are smart. They know where these are coming from. They come daily, and it's through their extra effort. They'll take an extra lap. They may walk around and break open a bag or two, but it's not, I wouldn't say it's a complete, I wouldn't take this to casino and bet this is 100% reflective of the systemic issues. And so this is just what we took on our own accord to document what was happening that we saw with our own bare eyes. And so, this is a list generated by us where we have documented photo logs from Clean Response, which is a third-party contractor, and where we have information from the garbage hauler where we suspect where this has come from. So this is driven by R&E for the efforts to work with the other stakeholders in this issue to fix this.
Thank you. Senator Curran.
Thank you, Madam Chair. And Senator Kubik and I are both looking at numbers and wondering if it's a training issue. I don't understand how all of them got it wrong in a month. And so I'm trying to figure that out. And right, so 2023, 87% were in 1 month. And then you go 2024, 85% of them were in 2 months. And then 2025, which also had over 70% reduction in overall in recorded instances, and they're mostly in 2 months. So that's kind of what I'm trying to figure out is what's changed on, and it's across a wide variety of facilities. It just happens to be 1 month, and you're telling us this is a whole year. I'm trying to figure out the pattern so we all want it to stop. Nobody in this room doesn't want it to stop, but it seems really odd that this is it, and there's no pattern. Or the pattern is it's 1 or 2 months, and then everybody gets it wrong, or the few people who don't comply get it all wrong in the same months. And so anybody have an explanation for it?
Mr. Hall.
Madam Chair, Senator, it was an unaddressed systemic issue up until 2023. No one had talked about it. And the reason why it's noticed at our facilities that we are a pre-processing facility. And I'll remind this committee that by 2030, every ton of trash in the 7-county metro will need to be pre-processed. So if you think this is only going to be Ramsey and Washington, it's going to be every metro county, or every county in the metro. And I don't envy hospitals in managing through a pandemic. I mean, they have stress, they have labor stresses there, and it's, I would say, poorly managed programs. And and it would get better, but then it would get bad, and because it's human error, it's training, it's allocating resources to support these contractors that should be separating red bag waste to red bags, and then we like garbage because that means we're making a bigger impact for the environment. So I like having the good garbage. I just can't have it mixed with infectious waste. So it was a systemic issue that wasn't being addressed.
Madam Chair?
Senator Curran.
I'm just still trying to figure out the your explanation. I understand how the facility works, but how just 1 month in 2023? And so, and that it's limited. That's what
I think that may be a question better directed at the hospitals, but from my understanding is that that's when we started documenting. It was happening 6 days a week.
Madam Chair, and I
Senator
appreciate the
Cran.
documentation. It's great, but there's just something that seems to be missing here. And thank God there's a reduction in it. And so, and I guess Madam Chair and Senator Pappas, I think if it was right, the fines are up to $30,000. There is some reduction. For a month in 2023, you probably had every day, it looked like, dang near every day. But it's not happening today, it looks like. And then we can fine somebody up to $30,000. And then, was I correct? Did the hospital association say they pay a fine in addition to they have to pay you the cleanup costs? Is that correct?
Mr. Hall?
I thought I heard that.
Madam Chair, Senator, yes. I mean, the cleanup costs, we're subrogating it to the hauler. The hauler then is subrogating it to the generator. But what I will say is that we've had generators that have had fines assessed to a tune of $100,000 that, guess what, they reoccurred. So, and I don't think focusing on fines is the best thing. I think, well, that's why it's a three-pronged approach. That's why there's physical controls that these hospitals should be adding, auditing their waste, along with inspections from the PCA to then make sure that they are doing what they should be doing. They have the plans in place. They know what they should be doing. It's just not happening.
Madam Chair.
Senator Cran?
And I think we all agree, right? They should be. And so how do we get that taken care of? And we don't see a pattern. That's what this doesn't show us is a pattern to easily address it. Everybody should be trained and it should be taken care of. So I think we all agree. I just think, I don't know any place else where we look at $200,000, $300,000, $1 million fine, and then $1 million fine to be shared with the vendor. I don't know that we've ever done that. So
Madam Chair.
I struggle with that piece of it.
Senator Pappas?
Madam Chair, I'm sorry that the fines are kind of distracting us from the problem. The fines are meant to get people's attention and bring them to the table. So I think the fines are all negotiable. I think we need to focus more on how we can solve this problem, because things can get better for a while and then suddenly they get bad again. So it may be that they had new employees, that they weren't properly trained. After there was a fine, then they cleaned up their act for a while. It may look like it's getting better, but then it could get worse again. We just need a better system in place to prevent the problem.
Thank you. I don't see other questions or comments. Thank you, Senator Pappas. It does seem like something that needs attention and needs additional work put in, actions put in place, and it seems like it should be happening at the generators to make this much less frequent. So I appreciate your work on this, and this bill will be laid over for at this time. So thank you.
Thank you, Madam Chair. Just a question, because I think it has to go back to environment, if there's going to be any funding involved.
I think it originated in environment.
Yeah,
correct?
they're expecting
And
it
they're-
back.
Okay. All right. We will take a vote, and Senator Boldon moves that Senate File 4187 be
Madam Chair,
passed.
can we request a roll call?
Senator Cran requests roll call. Roll call will be granted. Again, the motion, Senator Boldon moves that Senate File 4187 be recommended to pass and be referred to the Committee on Environment, Climate, and Legacy. Is that correct? And Ms. Ryan will take the roll.
Chair Wiklund?
Yes.
Vice Chair Mann?
Yes.
Lee Dutke?
No.
Senator Abler?
Yes.
Senator Boldon?
Aye.
Senator Fate? Senator Cran?
No.
Senator Kupek?
Yes.
Senator Liskey?
No.
Senator Port?
Yes.
There being 6 yes votes and 3 no votes, Senate File 4187 does pass and is referred to the Committee on Environment. Thank you, Senator
Madam Chair,
Pappas.
members.
Thank you, Madam Chair, members.
And now we will move to Senate File 4359. Senator Boldon. Senator Boldon.
Thank you, Madam Chair and members. So Senate File 4359 is a bill to protect county property taxpayers from the cost shifts in the SNAP program under H.R. 1. We've already had some conversation this evening about cost shifts to the counties. This is a bill to address that. And before I explain the bill, I do have an author's amendment, which is the A1, which clarifies that the bill's intent is to protect county property taxpayers from both the SNAP administrative cost increase and the SNAP benefit cost shift under H.R. 1.
Thank you. Senator Boldon moves the A1 amendment. All those in favor, please signify by saying aye. Aye.
Aye.
Any opposed? The A1 amendment is adopted. Senator Boldon.
Thank you. Now, this committee has had several conversations this year about H.R. 1 and the implications of this new federal law. One of the costliest changes relates to SNAP. H.R. 1 makes two major changes related to SNAP funding. First, H.R. 1 reduces the federal reimbursement rate for administering SNAP from 50% to 25%. DCYF estimates that this change will result in a loss of $39 million annually in federal SNAP funding to Minnesota. Secondly, H.R. 1 also makes states responsible for paying a share of the actual SNAP benefits. This is the first time in the 50-year history of the SNAP program that the federal government will no longer pay the full cost of SNAP benefits, which is a federal program. The amount that Minnesota will be required to pay will depend on the state's payment error rate, which is why I asked the question about it earlier. Payment errors are unintentional mistakes during the eligibility determination process, which result in either underpayment or overpayment in SNAP benefits. Many, as we heard, are the result of client errors, such as a client neglecting to provide an updated income information when reapplying for SNAP benefits. DCYF estimates the annual cost to Minnesota of covering this new share of SNAP benefits will be $97 million annually. Counties are simply unable to absorb these significant cost shifts, which would require unsustainable increases in property taxes. This bill would protect property taxpayers from these costs. The bill would cap the county's administrative cost share at its current 50% level. It would also assign the SNAP benefit cost share linked to the payment error rate to the state. I will add that the governor's supplemental budget proposal also indicates that the state should cover the SNAP benefit cost shift. Under this proposal, 100% of the non-federal SNAP benefit costs would be covered by the state. And Madam Chair, we do have some testifiers to say more.
Thank you. And I don't know who wants to go first. Commissioner Preisler, do you wish to go first?
Yes, thank you. Chair Wiklund and members of the committee, for the record, my name is David Preisler. I'm a LeSueur County Commissioner. LeSueur County is about an hour southwest of here, population of about 30,000, and we have the distinction of we do not have a stoplight in our county. I'm here today to testify in support of Senate File 4359 and to thank Senator Boldon for her leadership on the legislation. In Minnesota, over 440,000 people benefit from the SNAP program every month. Founded in 1964, which is actually the same year I was founded, the SNAP currently services 177,000 children, 70,000 seniors, and 56,000 adults with disabilities, again, in our state. Counties determine eligibility and operationalize the program throughout all of Minnesota's 87 counties. SNAP is an efficient and effective program. This program is a federal entitlement program with states and counties implementing the program. In Minnesota, counties determine eligibility for the program, and you may sense a theme here, utilizing the outdated and inefficient Maxis technology platform, which you just got to see earlier is prone to making errors or creating errors, and so it really, having still that technology exasperates our risk as we look at the error rate. And so another reason, quite honestly, to update that technology. Congress, as a part of the federal reconciliation effort, H.R. 1, in July of 2025, passed significant policy changes and new cost shifts, shares to states that impact SNAP, and Senator Boldon outlined some of those. these changes are in an administrative reimbursement rate and a new cost-benefit share determined by the payment error rate. Senate File 4359 ensures that counties are protected from these cost shifts. Without these protections, and I'm just going to give you one kind of small, medium-sized county's experience with this. So as we look at projecting it, you know, what this bill would do is keep us from putting about another 1.5% to about 1.7% on our property tax levy next year. Okay, that's the simple way to explain it, is that without this bill, that gets added into it. You've also heard some other bills here today. If you start adding all of those things up, again, the projection for our county is you're looking at somewhere around 5.5%, maybe 6% on the levy next year. And we haven't plowed a road yet. We haven't run our court system. We haven't done anything with our public safety. So it's kind of a death of not 1,000 cuts, a few cuts, but some pretty good sized ones that start to really add up. I'll also tell you that, you know, I know you saw a lot in the news with, you know, property tax increases. And our board fiscally, okay, is a pretty conservative board, okay? We had a 4.4% levy increase this past year, which is almost half of what the statewide average was, okay? And we had to dig into reserves in order to maintain that 4.4%. That is not going to be sustainable long term, okay? We're very sensitive to the property taxpayers in our county. We are really short on commercial industrial property, and we're kind of a classic bedroom county, all right? The majority of our workforce works outside the county, okay? They go to our neighboring counties like Scott or Blue Earth to work. But it kind of, so we've got homes and we've got farmland. And we've got very, very little commercial industrial property, so it really puts that pressure on farms, and it puts that pressure directly on homeowners when we start having some of these property tax things that go on. So I'll just finish up quickly. Also, a little bit more directed to our county. We currently serve 569 households within our county with the SNAP program, and again, that's out of a total population of 30,000. And we're not a poor county. We actually, from a standpoint of average household income, we have the highest in South Central Minnesota. But it is still $30,000 per household less than Scott County. And so there's differences as to what counties can kind of really afford here. And don't get me wrong, we love Scott County, okay? They're our neighbor directly to the north. We love them, okay? To wrap up, counties are simply unable to absorb these significant cost shifts, which would require unsustainable increases in property tax levies across our state. In closing, thank you again, Senator Boldon. We urge the committee to support Senate File 4359. Thank you, and I'm available for questions.
Thank you. And now we have Barb Dahl. If you could please state your name for the record and begin.
Yes, Chair Wiklund and members of the committee, thank you for the opportunity to testify today, and thank you to Senators Boldon and Port for authoring this bill. My name is Barb Dahl. I'm the Health and Human Services Director for Scott County, and I'm representing both the Minnesota Association of County Social Service Administrators, or MACSA, and the Minnesota Intercounty Association, or MICA. And we're here asking for support for Senate File 4359, which protects counties from significant cost shifts tied to federal changes in the SNAP program. As was discussed, H.R. 1 implements really two major fiscal changes, a 25% reduction in administrative reimbursement, and states having to pay the SNAP share for benefits, which we have never had to do before. This is a cost that is driven entirely by the state's payment error rate. It's important when we look at the payment error rate to note that payment errors really, they're not fraud. They're unintentional mistakes. Sometimes they're overpayments, sometimes they're underpayments. In 2024, 41% of all errors were actually caused by our clients just due to turning in something late, or perhaps it was just incomplete reporting regarding their income or an income change. Counties correct these errors when they occur and will offer an issue and then collect overpayments regarding that. A few weeks ago, I had the opportunity to come here and talk a little bit about what that looks like at the county level if we kind of really dive into the numbers. And I think given our system modernization, I just want to walk through that again. So if we were looking at 2024, Scott County served 4,000 SNAP cases. 10 of those cases were pulled for the payment error rate, looking at the quality control, so just 0.3% of all the cases that we served that year. Across those 10 cases, $2,113 in benefits were issued, and of that, $149 was deemed an error. Yet under the new federal rules, that could translate into $1 million to Scott County taxpayers. So $149 in errors, and we saw how easy it would be to make an error of that just small amount. That has the potential of a 7-figure penalty for Scott County. It's not sustainable, and it risks forcing counties to cut services that support vulnerable families. This challenge is compounded through narrowing exemptions for the program, expanding work requirements, and more Minnesotans are now going to have to track their work and their exemptions, which requires our staff to add additional administrative tasks. We have increased likelihood of errors, and then there's just increased churn because we know that more people are going to go off and then come back and want to reconnect, which takes staff time. So this is all during the very moment when we're being held financially responsible for this. Again, as we saw, we really are working with outdated systems. Policy changes often outpace these updates, and they're forcing staff into manual workarounds. Every workaround increases complexity and risks for errors, yet counties don't have any control over this. Counties are administrative arm of the state. We don't set the eligibility rules. We really didn't pick the system you saw a little bit earlier today. And we can't change federal policy. Yet we're being asked to absorb the financial consequences of decisions made entirely outside of our authority. For these reasons, we ask that SNAP, which is a federal entitlement program, that we urge that you support Senate File 4359 to protect counties and local taxpayers from these unprecedented cost shifts. We thank you for your time and consideration, and we're happy to answer questions.
Thank you. Members, any questions or comments about the bill? Senator Utke.
Thank you, Madam Chair. And just going back over a couple of the numbers, the amount to cover the error rate as we know it today, that was the 97 million that you stated earlier, correct?
Senator Boldon.
Thank you, Madam Chair. Thank you for the question. So DCYF estimates that the annual cost to Minnesota of covering the new share of SNAP benefits was $97 million. The error rate, the DCYF estimates that the change in administering the plan, going from 50 to 25% coverage, will result in a loss of $39 million annually.
Senator Utke.
Thank you, Madam Chair. So it's 39 plus 97, correct?
Senator Boldon.
Thank you, Madam Chair. Senator Utke, those are the estimates for those two pieces from DCYF, yes.
Okay.
Senator Utke.
Thank you, Madam Chair. And yeah, at this point, all we got is, the best estimate possible. But I just was looking to see what the total is. So thank you.
Other questions or comments? Raise hands. I don't see any others, and I don't see any raised hands. Senator Boldon, any other thoughts, final thoughts?
Thank you, Madam Chair. Thank you again for hearing this bill. Again, just to reiterate, as we heard from testifiers, the new SNAP increases are really untenable for counties to shoulder. And those costs are going to get shifted from the counties onto property tax payers. In most of the country, SNAP is administered at the state level, and therefore states will be absorbing these extra costs under H.R. 1. Minnesota similarly should find a way to absorb these costs at the state level, albeit we shouldn't have to be finding a way to absorb these costs. This is, again, a way that the federal government is putting us in a terrible position. But that decision has been made, and we are forced to deal with the consequences of it. So thank you, Madam Chair.
Thank you, Senator Boldon. Yeah, we were trying to address issues that weren't our choice, and appreciate your bringing the bill forward. Senate File 4359, as amended, is laid over. Senator Boldon, Senate File 4545.
Thank you, Madam Chair. Senate File 4545 relates to sorting out an unintended consequence when two of the supports that we have passed over the last 2 years to protect workers are now in conflict with each other in the child care field. The first, the Great Start compensation support payments, were made permanent in 2023 and are of huge and continuing importance to providers. These non-competitive monthly payments are available to all eligible providers. Legislative intent was to ensure that the funds supported those who regularly care for children. That's the language in statute. In order to receive these support payments, providers must fill out monthly applications, and the applications detail the hours worked for all staff who are regularly caring for children in the previous month, with 32 hours a week considered a full-time equivalent or FTE. If staff work more than 32 hours a week, they can count for up to 2 FTEs, but not more. Then DCYF sets a dollar amount that it pays for each FTE. From the program's inception, DCYF has narrowly interpreted the regularly caring for children to mean only the hours a staff member is physically counted in ratio to meet licensing requirements. This means that only work hours in the classroom count for the monthly compensation support application. The second support in question that's in conflict came when employment law then changed in January of 2026 of this year, specifying new employee break time requirements. Hourly workers are now required to receive a minimum of 15 minutes paid break time within each 4 hours worked. For a full-time employee, this can equate to 30 minutes of paid break time each day, which is important and we support. Prior to January of 2026, breaks were also required, but the requirement was for adequate time to take care of personal needs, such as restroom breaks. As such, child care staff received breaks, often more frequently and in smaller increments than 15 minutes every 4 hours, and often on a flexible basis. When staff needed a break, they asked for one, and management or other staff member would step in to relieve them and maintain the ratio as soon as possible. Providers were not tracking these short breaks to the minute, and as such, they were included in the work hours reported on monthly compensation report applications. The law change in January moved from adequate time to at least 15 minutes. And so in December of last year, DCYF clarified that these new 15-minute break periods would not be allowed to count towards the FTE hours on compensation support applications. So we now have 2 laws that are intended to support employees in conflict with each other. On the one hand, providers must provide paid breaks of 15 minutes. On the other, the state is saying that these newly defined breaks cannot count as FTE hours spent caring for children. So this creates a situation where providers must now reduce the FTE hours reported on their compensation support applications, which then has the potential to reduce the amount of support dollars received. This presents a potential direct and negative impact on staff compensation. So in wrap here, our goal here is twofold: not to have anyone's compensation be reduced due to the conflict between these 2 laws, and not to increase the administrative burden on child care providers who are already excluding several other portions of staff work time because they don't meet DCYF's narrow definition. And to say a bit more, I will turn to Claire Sanford, who will testify, Madam Chair.
Thank you, Senator Boldon. Did you want to discuss your amendment to start with, or do you want to wait and talk? Or there's an A1 amendment, but I don't.
Thank you, Madam Chair, for that reminder. I am happy to say a bit about the amendment now. And so we started with a few other exceptions, including PTO, including some training time, and the amendment removes that and limits it to just the 15-minute break periods.
Okay, thank you. Members, let's take action on that author's amendment. Senator Boldon moves the A1 amendment. All those in favor signify by saying aye. Aye. Any opposed? The A1 amendment is adopted. Ms. Sanford, if you could state your name and begin your testimony.
Thank you, Madam Chair, and thank you, Senator Boldon. Nice to see everyone again this evening. I'm still Claire Sanford, representing the Minnesota Child Care Association, which is a statewide association representing specifically licensed child care centers. And realizing that this new break law that was going into effect presented special challenges to a highly regulated, ratio-based industry, MCCA hosted an event for members, actually for any provider, member or not, on the new requirement last fall. The event featured staff from the Department of Labor and Industry, and we had the highest attendance at this event of any of these training type events we had done in recent years, which just demonstrated providers' concern with how to document and manage these expanded requirements in a ratio-based operation, but also their desire to do it right and to fulfill the law. Break time to attend to personal needs is obviously incredibly important for any employee's well-being, and in our world it takes on an additional critical dimension. As anyone who has ever had or spent time with young children knows, it's physically and emotionally demanding and often downright exhausting, and ensuring that staff get time away from those responsibilities isn't a nice to have, it is a must-have for the safety and quality of the service provided young children. With this bill, we're simply asking for providers to be held harmless in the Great Start Compensation Program and how it interacts with this break law. We are not trying to get more hours added to centers' applications to try to get more compensation dollars than providers were getting pre-January 2026. We simply want to ensure the new break law does not lead to providers receiving less compensation support than they would have prior to January, and to relieve a new administrative burden. This is a consequence of the interaction of the new break law and the DCYF narrow interpretation of statute. Quote, staff who regularly cares for children, end quote, is the statutory language for those eligible to receive Great Start Compensation Support funding. And that is defined by DCYF on its website as a paid staff person whose job description or responsibilities include interacting with, caring for, and supervising children enrolled in a program. However, in practice and on the monthly applications for compensation support, DCYF narrows this definition to only include, quote, hours worked directly caring for children during the previous calendar month. That narrow definition is narrower than the website DCYF's own definition of a person whose job description or responsibilities include caring for children, and one that now needs to be counted to the hour. This means that providers already every month must scour each month of employee records to scrub any hours spent not directly caring for children, such as planning time, conferences with parents, or attending legally required training. That is all still work time for teachers, but it doesn't count as work time for the compensation application. In December 2025, providers were surprised to get clarification from DCYF that the about-to-be-required break time law would not count as hours towards these compensation applications. And to be clear, child care providers and teachers in centers were getting breaks before January 2026, but the language then was to allow adequate time. The major change has been to formalize that these breaks must now be a minimum of 15 minutes in length, which the next testifier, which she's not here, so it'll be me with her testimony, will discuss. We feel that by allowing the 15-minute required breaks to count as eligible time on these support applications is allowing us to really continue what was standard practice before the January 2026 change to employment law. They were covered before, and we want this to continue. And thank you, Senator Boldon, for being our author. The criticality of these compensation support payments in general to providers cannot be overstated. They have allowed us to raise compensation without passing those costs directly on to the families that we know cannot afford it. Thank you.
Thank you. And so you said the other testifier is not able to be here tonight. Did you want to make any other comments about that or not? Or is it?
Madam Chair, yes, thank you. Lauren Welch Lofrumento, who is the Chief Operating Officer of Children's Discovery Academy, which has a center in Little Canada and one in Vadnais Heights, wanted to be here to testify in person. She wasn't sure if she would be able to make it. She has her own little one at home. And she also submitted written testimony, and I won't read all of it. I'll just highlight the piece that I think illustrates what we were just talking about. So this is from Lauren Lofrumento's testimony. Before the paid break law, classroom staff had flexibility to use the bathroom, grab water, or take short breaks, sometimes when remaining in the classroom, and all of that time counted toward their Great Start compensation hours. Now staff are required to take a paid 15-minute break, which reduces the total hours we can submit for the grant, even though those same needs were previously met without deducting that time. With the new paid break requirements, it's also become very difficult to track classroom time versus paid break time, since both are coded as regular pay. This creates unnecessary and tedious administrative work for both office staff and employees or teachers due to what feels like an unintended consequence of the law. Thank you.
Thank you. Members, any questions or comments about the bill? Anybody online? I see no questions. Thank you, Senator Boldon, for bringing this forward. It does seem like both from a perspective of we want professionals to, in the classroom and in home environments to be taking care of kids, but we realize that they need breaks. That should be part of their work, just as it is for a lot of other people. And to think that it might negatively impact what they receive from the Great Start payments really seemed like a problem that we needed to solve. So I appreciate you bringing this forward. And hopefully we can continue to have discussions about other things that are considered not a part of the hours that are counted for the Great Start payments, because I think one could make an argument that professionals deserve to, they need training so that they can do their job in the best way possible, and they need some time off, just like a lot of other people get paid time off. So, but we'll leave that for a future discussion. So, thank you again, and Senate File 4545 as amended is laid over. Thank you so much. Members, before I move to the Senate File 4324, I was alerted by my committee administrator that Senate File 4719 needs to go to the State Government Committee. That's the IT modernization bill, needs to go to State Gov because of the steering committee aspect. And so I'd just like to bring that bill up again and see if we can, let's see, what do I need to do? Do I just bring it up and then just make a motion to refer it to state government? Okay. So I'd like to make the motion to have that Senate File 4719 be recommended to pass and be referred to the Committee on State Government. Any questions? Okay. All those in favor, please signify by saying aye. Aye. Any opposed? The motion does prevail, and Senate File 4719 is passed and referred to state government. Thank you. And now I will go to Senate File 4324.
Senator Wiklund, to your Senate File 4324.
Thank you, Madam Chair, and thank you, members, for getting. We've had a long day, and I appreciate your attention to this final bill. Senate File 4324 is a bill that relates to child care licensing modernization. The goal of this bill is to provide for modernized licensing standards for family child care settings and center-based child care settings in state statute, rather than the combination of statute and rule that we have in place today. As you have heard over the past couple sessions, and most recently in our committee in February this year, DCYF has been working on this project along with the development of the weighted risk system and abbreviated licensing visits. And they issued a final report in January with draft language, and that became the basis of the bill, the first draft that we had to attach that day when we had the presentation. That's been what is posted. But the discussions and the work to bring this product forward goes back a lot farther. In my time in the Senate, I have consistently heard that our licensing standards are out of date. The rule for family child care, you can see that it was enacted in 1985 with some intermittent updates since then. And in 2019, there was a Minnesota Family Child Care Task Force that was convened, and we talked about, I was part of that, and we talked about a lot of issues that we've been working on since then, and one of the key issues was regulation, and the task force did come back with a recommendation that DHS modernize licensing standards in rule and statute. Another consistent issue that has been raised over time is that the rule and the statutes are not organized in a way that makes it very easy or conducive for childcare providers to run a successful business. This bill brings together items that today are in statute, maybe like a training requirement, and then puts it together into one chapter so that training requirements aren't separated out. There's not a real apparent rhyme or reason for what's in statute as compared to what's in the rule. So this would bring family child care standards into one chapter and another for center-based child care. I bring up the past concerns and the extensive work done to move this project forward to kind of raise our sense of urgency to seriously consider this bill this session. We hear about the need for additional child care providers, child care deserts. That's across the state, and we know that there's a large economic impact on families who can't find care. One way that we can make a difference is to complete this legislative work before us and allow the agency and providers to move on to work on actual implementation, which will take over a year from the time we could pass this bill. Deciding to leave the work undone this session, in effect, puts implementation of modernized standards out until mid-2028. I think it is important that we make the effort to assess the bill language and put forward suggestions to see if we can do better and do that more quickly so that these standards could be put in effect, and we can help those who provide care for Minnesota's children. DCYF has made changes since the report was delivered. For example, there's language that regarding sleep checks for infants, some of the food requirements, language change on use of behavioral restraints. And so there have been some changes, and those are not reflected in the underlying bill that is before us. So today's chance is a chance to hear from testifiers and to begin to assess where we need to make amendments to the language if we wish to see this move forward. So what I would like to do tonight is adopt the A26, which is the base bill with just technical changes that Senate Council has reviewed, and the reviser made some technical updates. And so from the bill, the base bill that you have, I would like to adopt the A26 amendment and as an author's amendment to get that part done.
Senator Wiklund moves the A26 amendment as an author's amendment to get it in the shape in which she would like to have it heard. All those in favor say aye.
Aye.
All those opposed say nay. Amendment is adopted. Senator Wiklund.
And then to orient you to other amendments that you have in your packets, one of them, the A1 amendment, that is the result of work that I've been doing with one of the stakeholder groups that family child care providers have brought to me. So these are some of the changes that this group sees as really important that we make to the bill. And it is challenging with this length of a bill to, be able to look through an amendment and see, where do all these things fit? I'm not going to go through all of them. I don't want to adopt it tonight, but I do want members in the public to look through and see if there are changes that are recommended by this amendment that would improve the bill. And then you have the A3 amendment and A4 amendment. Those were prepared based on language changes that DCYF has recommended based on their work with stakeholders. And so the A3 amendment reflects changes that were not included in my A1 amendment. You'll see things like a change to the infant sleep check language, changes to the food language, and more. There are other items as well. So that's one that the agency brought forward. And then the A4 amendment reflects some changes that are kind of in conflict with the ones that I brought forward in the A1. So they're like an alternative to some of the changes in the A1. And I don't expect that we will, go through these in detail tonight, but if you have any questions about them, I can answer them. But I know we have a long list of testifiers, so I would like to go to testimony now, and then I can answer questions.
Very good. Thank you, Senator Wiklund. We do have a number of testifiers. First will be Cindy Cunningham, and after that, Claire Sanford. Ms. Cunningham, when you are ready, please introduce yourself and begin.
Thank you. My name is Cindy Cunningham, and I'm a licensed family child care provider of 30 years licensed in Ramsey County. I also serve as a certified trainer course writer with the Achieve Guidelines and the public policy chair for Lead in Care, which is a 501c3 association representing licensed family child care. When I refer to we or I, it is inclusive of the Lead in Care Association. Due to the nature of our businesses and the statewide settings, we work hard to stay bipartisan and work towards that goal with everything we do. Our board comprises 6 members from across Minnesota, and I lead a committee of 4, each deeply engaged with provider perspectives within their respective regions. We interact with child care providers throughout the state using social media tools such as polls and surveys, encouraging input, sending newsletters, and engaging in ongoing conversations. The I is not just me. It has been a privilege to work with Senator Wiklund through this whole project and being on the Family Child Care Task Force where this originated. Many have heard me since November state that we wanted a collaborative bill which didn't need so many amendments. We don't have that in front of us. It's going to take amendments and more work over time. We are in a position to be wrangling this bill forward at this point in time with provider frustration and some who are in opposition to any and all parts of the bill. The DCYF proposal came out in early January, and immediately our committee worked through the details to make a marked up version and created a document to use as a vehicle to attempting to bring forth our highest concerns. We met with legislators since January and DCYF since early February multiple times. We appreciate everyone's engagement, DCYF legislators and providers. What we do have in front of us is a bill that's slightly better, than a previous drafts in some ways. Increased infant and toddler ratios, as one stream of licenses, and inclusion of additional pets. Yes, that's really important to our care settings and our own children. What we also ended up was getting additional and intensified regulations which have not come under publicly discussion until now. These changes, which are the primary focus of our amendments of the A1, and discussions has come after the shift last July to the new department. The shift also brought new staff and a lack of engagement with the staff person who we did have some historical positive relationship with. The department seems to have a negative bias and lack of understanding of our industry, and I have to ask the question why. What I realized is that this is a dynamic also of the delegated license that our county licensors know us well through the good and the bad. The state agency only sees us through the lens of the bad, the correction orders and the licensing actions. And then I have a whole bunch of scribbles, so we're going to see where I go. Sorry. Though not one of the amendments presented tonight, we no longer support the move of variances to the state due to the lack of understanding and the positive regard for our industry. This variance system needs to stay with the counties until the state agency can experience FCC as a full and positive care setting with the respect that we're due. I will add this is a move I've wanted to have at the state level for over 8 years. Because we have counties who make a determination to not do any variances because of the county liability, and we have counties who will frequently give variances. So there's an inequity inherent in there, but there's great concern from many in the provider field that the state would be able to handle those variances and as a supportive role as our current licenses do. The hope is we would be able to build these relationships and views and be able to move forward in a future with a state oversight so all counties can have their part. There are those calling for a vote against this bill tonight. We ask that you please pass the amendments to the bill and keep us moving forward. As an example for some of the bills, I couldn't hardly figure out where the amendments were. And we just got them today, and we just got the agency's amendments today. So this really is a work still in progress. A few oversights for what we have brought forth in the A1 amendment is there's a number of definitions to be clarified, to be added. We've asked for capacity in the ratios. There was a removal of the infant toddler license, and there is a need to have a new added into back into the ratios, what we're terming a C category for infants and toddlers. There's also need for inclusion of the supervision of provider's own child that was in the draft too. For training, to remove some additional training for the C3 and the new C4. Move providers who are trainers in the order of the bill, and for the attendance records and firearms, the attendance records, we're asking that to still just be for, programs such as CCAP, early learner scholarships. They're required, and they're already required, not an expansion to other attendance records. Firearms, we took lots of time. We know this is a hot issue. We know it's an important issue. However, we're trying to come up with something where we can work with our clients in a interview process and work with the public without compromising our privacy and in the whole process in our things. So we're asking for just the storage. The current proposal is that we would disclose to our clients if there are firearms or not. And I can diverge here, but I can personally say as a young child, my dad was a hunter, trained dogs, and I have the experience of having my house broken into as a child and had all of our firearms stolen. Stolen firearms are a huge issue. So that's just one of the pieces where we feel that if there's a conversation with parents and interviews, we have an honest conversation with, there's a big difference putting it in a conversation versus putting it in a document that we have to share with people. The behavior guidance, we want to remove timeout, and also, I think it got passed in the other amendment, the cribs and high chairs restriction, right? Sorry, still catching up. So adding some age appropriateness. There was a smoking on premises that we would have to divulge, and we're the outdoor air. We deal with fires all the time. I'm not sure where that goes. So we don't want to have to try to balance and work through the piece about what happens on our property outside of childcare time. We are pleased tonight now to hear about the removal of the mandated oversights infant checks. This is really late tonight. To remove that, and then also to do the meals. There were some other things that we had also that are in those lines. So if these are adopted and combined and brought together with the others, it can move forward, we feel. We can feel it can go through the House Conference Committee. I have been really pushing and stating, if we don't pass this, we go back to what we have. 9502 stays in a rule. We've been functioning that. We've been doing this statute. A lot of people say, well, what's the big deal? Well, the big deal is we then can't do anything in 9502 or 9503 for the centers. This is the same situation without the agency opening up that rule and making determination of meetings and hearings, unless there's some way to, if this doesn't pass, that this gets laid over for next year, reintroduced, and 9502, 503 still stays open. If this isn't passed in some fashion where everything is brought into statute, it will be as if nothing's happened. And there's been a lot that's happened, and we need straight statute, as Senator Wiklund said, so that we can go to one spot.
Thank you for your testimony. Next will be Claire Sanford. After that, Lisa Thompson.
Thank you, Madam Chair, and thank you, Chair Wiklund. Claire Sanford, Minnesota Child Care Association. We were honestly surprised to see that whatever remaining funding is necessary to get this modernization project over the finish line was not included in the governor's budget. It's already been a 5-year project, and the plea tonight is really from child care providers to please to the legislature to get this done this year. As Chair Wiklund noted, it will still take quite some time, even after we do get new standards over the finish line, for them to be implemented and for providers and families to feel the effects. We had hoped to finalize the new standards last session, but experienced another delay. And as I've said before, the continued purgatory of the current outdated and ineffective licensing system has real consequences beyond providers' heads exploding. Childcare as a field is experiencing a major insurance crisis, with very few insurers left on a national scale even willing to insure childcare providers. And those who are lucky enough to get or keep insurance are looking at 30 to 60% premium increases at every renewal. This directly affects childcare supply. Insurers research the same public licensing violations on the same website that families or any of us can go to. They're not nuanced, they're not transparent, and they make their determinations on their liability for insurance based on some of these things. And I don't need to document licensing violations. You've heard all of them for many years. So overall, MCCA is pretty pleased with the current draft of standards and thinks it's a big step forward from earlier versions, which is wonderful. There are some potential cost savings for providers in there. There are some flexibilities for providers in there. We, of course, will be offering some suggestions for amendments going forward, but have no fear, not tonight. And really, the plea is just please to the legislature, let's get this over the finish line this year. Thank you.
Thank you. Next, Lisa Thompson. After that, Martha Nolamole. Apologies for mispronouncing your name, which I'm sure I'm doing. Please introduce yourself and go ahead.
Hi, Madam Chair. Thank you. My name is Lisa Thompson, and I am our state's ombuds for family child care providers. The testimony I am bringing to you today is based on the input that I've received from family child care license holders across the state. And I've gathered these stories and comments through multiple in-person meetings with provider groups and direct outreach from individuals who are concerned about their ability to continue operating their businesses and how the changes in regulations will affect that. Family child care is a unique option for families within our early learning system. It's also the most affordable way to deliver this essential part of our economic infrastructure. And this testimony is specific to the proposed changes affecting family child care. As the name describes, family child care provides young children a family-like experience. While the goals are the same as other care and education options, family child care provides young children with a secure, relationship-based care that's so vital to their healthy development. Siblings stay together, community connections are strengthened, The littles learn from the older children. The older children learn valuable lessons from the little ones being around too. And while these environments mirror home life, we should not undervalue the skills and expertise that family child care providers bring to their work. Now, this bill to modernize state statute is important, but I also want to make sure that we remember that the problems in our child care system will not simply be solved until we also make significant and meaningful changes to how regulations are imposed on programs. We need to make sure that our energies are focused on ensuring children are safe and well cared for, instead of which T's are dotted on which forms and which boxes are checked. I'm not going to go into the details of this really huge bill and undertaking to revamp the statutes and the standards, but just a few examples of specifics in this bill that would either help or further hurt family child care. I'll point them out. A couple of helpful ones. Putting all the regulations in one place. This is huge. It may not seem like it from the outside, but when we take into consideration that there's little to no regulatory training for license holders, I'm sure you can understand why what the importance is, at least having the rules in a single place. Another helpful change would be removing the requirement for things like, for example, a landline telephone, and allowing electronic documents are both great examples of regulations that finally bring us into the 21st century. Another helpful change would be to ratios and capacity numbers for family child care. And this is the single most commonly praised item in this bill. The changes are a prime example of how important it is for the state's regulators to involve and listen to the people who are directly impacted when making changes. A couple of the more hurtful side. Failing to remove any areas of nuance in regulation. It leaves license holders in an untenable position that really is driving people away from this profession. Some wording, for example, adding the word immediately to the supervision requirement. It's an impossible standard to meet, and we really make it an impossible job when we do add nuance. We never want the rule to become more important than the purpose of the program and the care and education of young children. Another example, each added requirement for documentation, and there's a lot of them added into this bill, takes the adult's attention away from the children and opens yet another window for the regulatory punishments that are pushing people out of this work. Another hurtful, adding rules that are appropriate for a child care center environment, but really don't make sense in a family environment. For example, stringent cleaning protocols are important for large groups of unrelated children, but not necessarily in a home with small group. And requiring the commissioner to have access even when children aren't present is appropriate in a commercial setting, but certainly not in private homes. My last example, requiring that all adults have clearance from a medical professional before working with children is an unreasonable imposition when we consider the challenges people face accessing affordable health care. The regulations allow licensors to order an exam if there's ever any question about the provider's fitness, and it really would be sufficient. So while there are areas that need to be updated to be responsive to, yes, our modern life, not the 1980s, new requirements should be avoided whenever possible under this already heavily regulated license. Please, I'm asking this committee to consider supporting families with young children by protecting their options and their choices without adding more burdensome requirements for license holders. Support our children by providing a regulatory environment that truly prioritizes their learning and their development. And support the people who do the work by listening to and valuing providers' input on these new regulations. Thank you.
Thank you for your testimony. Next, Martha Nolamole. Again, please correct my pronunciation. Apologies. After that, Holly Seville.
All right. Thank you, Madam Chair, members of the committee. And I would just like to say before I go on, I have read all sorts of variations on the last name, so you're fine. So my name is Martha Nolamole. I am an economist at Center of the American Experiment, where for the last 4 years, I've written extensively on Minnesota's affordable childcare crisis and how it affects families, children, and the entire state economy. I have provided a handout, a more detailed handout that goes through why we need comprehensive childcare licensing reform in Minnesota. So in this hearing, I want to speak exclusively in support of 3 major changes in this bill that will go a long way in addressing worker and childcare shortages in the state. These are, number 1, reduced hiring and training requirements for center staff, including teachers and assistant teachers. Number 2 is the higher capacity limit through the creation of the C4 license and racial flexibility for family childcare providers. Minnesota is one of the least affordable states for center-based care, which research suggests is due to overly stringent regulations that restrict supply and raise prices. In 2024, it cost over $20,000 for Minnesota families to send an infant to a licensed daycare center. After adjusting for income differences, Minnesota ranked as the 9th least affordable state, with infant daycare costing twice as much as in South Dakota and 1.5 times as much as in North Dakota. Unsurprisingly, in the State Child Care Regulations Index published earlier this year by the Archbridge Institute, Minnesota ranked as the 10th most restrictive state nationwide. In the Midwest region, only Wisconsin, another high-cost state, maintains a more prohibitive regulatory climate. North Dakota and South Dakota both outperform Minnesota on the index and on affordability, indicating a strong link between regulatory stringency and childcare costs. Worsening the childcare affordability, especially in greater Minnesota, has been the exit of family childcare providers from the market. According to data from the Department of Children, Youth, and Families, since 2007, Minnesota has lost over half of its family childcare capacity. In 2025, family childcare accounted for less than a third of total capacity in the state. This is down from over 60% in 2007, leaving parents with fewer affordable options. We need more childcare slots to address shortages and high costs. Making it easier for centers to hire workers, as this bill suggests, will alleviate worker shortages and potentially increase operating capacity for a lot of centers. Allowing home-based providers to care for more children, especially younger children, will also allow them to recoup revenue that they have lost by losing older children to pre-K programs that have expanded in recent years. It also addresses shortages, particularly in greater Minnesota, where family childcare is usually the only option. More needs to be done to lower the regulatory burden for providers, but these changes, I think, are a step in the right direction. I urge this committee to support this bill. Thank you, Madam Chair and members of the committee.
Thank you for your testimony. Next, Holly Seville. After that, Courtney Greiner.
Hello. Thank you, members of the committee, for allowing me to testify tonight. My name is Holly Seville, and I'm president of the Minnesota Association of Child Care Professionals. I've been a licensed family child care provider for 21 years. I've worked in public schools and centers. I've also been a trainer for early childhood and school-age professionals for the last 16 years. I'm here today on behalf of Minnesota's 5,423 licensed family child care providers and the families we serve. Family child care is not a system. It's not an institution. It is someone's home.
It is where babies are rocked to sleep, where toddlers learn to share, where preschoolers build character, and where school-agers develop compassion. The outlook for family child care is already fragile. Minnesota has lost more than 6,500 licensed family child care providers in the last 15 years, more than half. That means fewer options for families, longer wait lists, and entire communities, especially ones in greater Minnesota, without child care. This bill will make that worse. Not because providers don't want accountability, we do, but because the bill goes far beyond health and safety and into control. It adds layers of subjective, vague, unclear, and burdensome requirements that do not reflect how family child care actually works. Let me tell you what that looks like in real life. It looks like providers being forced to make expensive structural changes such as fencing yards, regardless of the size, modifying basements, and redesigning play spaces that many homes simply cannot accommodate. It looks like providers being required to follow outside directives that may not be safe in a group setting, undermining their ability to protect all children in their care. It looks like vague language like unpleasant odors that are incredibly subjective and being used to judge providers differently depending on the county and the licensor. And it looks like more paperwork, more policies, and more training requirements without any evidence that it actually improves safety. But the most concerning part is this. This bill will make providers think twice about staying open. And it will make some decide that it's no longer worth the risks or the costs. Because when you increase cost, liability, and uncertainty all at once, small home-based businesses closed. We have already seen it happen, unfortunately. And when providers close, families lose. Children lose stable, relationship-based care. Parents lose the ability to go to work or are forced to pay significantly more for childcare. Family childcare is the most affordable form of licensed care. An infant spot in a family childcare costs half of that in a childcare center. Communities lose one of their most essential supports. We all want safe, high-quality care, but modernization must be clear, workable, and sustainable. It must protect children without pushing providers out of the profession. Since 2016, the legislature has formed committees and a task force to address the mass exodus of licensed family child care providers, including the Legislative Task Force on Access to Affordable Child Care. One recurring theme in their reports to the legislature was that overregulation, burdensome paperwork, and licensing misinterpretations have exacerbated the loss of providers. In fact, DHS presented this modernization project as a way to streamline and reduce regulation, but they've doubled down on it instead. We are asking you to pause to make sure that we get this right. We emailed all of you our detailed analysis of the proposed language, a summary of our concerns, and a red line copy of the previous language with our proposed edits. We implore you to amend this bill to include our suggestions. We do appreciate DCYF and Senator Wiklund incorporating many of our suggestions in the A3 and A4 amendments, and as far as I can see, we don't have any concerns with the A1 amendment now, but obviously they would need to be reconciled. We also want to say that one thing we do support in the bill is the addition of more license classes and the capacities, as this will open up more spots for all ages, especially infants and toddlers, and we know that there's a critical shortage of care for them. Please reject this proposal in its current form and work with providers to create solutions that protect children, preserve access, and keep family child care viable in Minnesota. Because once these providers close, they don't come back, and neither do the options that families depend on. So thank you for your time and consideration. I'm not going to go through the detailed concerns we have because we've already shared those with you, and I know you want to get home. So thank you.
Thank you for your testimony. Next is Courtney Greiner, and I will also welcome to the table Celeste Finn.
Good afternoon. It's good evening. Good night, maybe even. My name is Courtney Greiner, and I am a child care provider in ESCO. I started as a teacher in a child care center. I was then a mom who sent her kids to child care, and then I did family care prior to now owning a center in ESCO.
Providers like myself have shown up consistently throughout this process. We have read, reviewed, draft 1, draft 2, draft 3, given feedback, and worked to help shape something better. It's late nights, early mornings, and weekends. And I want to be clear, this version is good, but it's not good enough. There are still changes we would like to see, but more importantly, this draft continues to miss the deeper issues in our system. The challenge isn't just language. This system still leaves room for interpretation. It creates inconsistent enforcement and maintains a power imbalance where providers are left feeling disenfranchised, burnt out, and unsupported. It doesn't actually improve care. In many cases, it pulls time, energy, and focus away from children without clearly preventing harm in a meaningful way. So as you consider this bill, I urge you not to just view draft 3, this bill 4324, as a finished solution, but as a piece of a puzzle. We're asking that the additional puzzle piece be the Minnesota Board of Early Care and Education, one that is co-created, includes a diverse board of experts, and is centered in providers. A board like this would not just set standards once, it would continuously review, adapt, and improve them based on current research. Also real-world experience and how children actually learn and develop. Because childcare cannot be something that we overhaul every 50 years. It should be an ongoing thing. It should be something that's constantly improving. And without a structure like this, we risk remaining stagnant, continuing to rebuild systems that don't fully work instead of evolving them in real time. A provider-centered board prevents that. It creates the system that evolves because children are constantly evolving and the systems that care for them should be evolving too. Thank you.
Thank you for your testimony. Next, Celeste Finn, and also you are welcome to come to the table, Amber Sidlaski.
Good evening, Senators. My name is Celeste Finn, and I'm the founder and executive director of Big Wonder Childcare here in St. Paul. I'm here to urge you to adopt the amendment to Draft 3 Bill 4324 to establish a Minnesota Board for Early Care and Education. I know it's late, and these licensing changes are overwhelming, but kindly please stay alert. The childcare infrastructure in Minnesota is in real crisis. Existing licensing is one force driving this. When I started Big Wonder 3 years ago, I faced incredible challenges. Many were caused by the poorly written and inconsistently interpreted licensing regulations. First, I couldn't enroll children until I was licensed, but I wouldn't and couldn't be licensed until 1 week before I intended to open. Consequently, I opened with just 2 children, went unpaid for months, and was on the precipice of folding from day 1. My experience, I learned, wasn't standard. It was how my licensor interpreted and decided to enforce Rule 3, something I was powerless to question. Licensing standards also changed mid-year. For example, from iced coffee in a thermos being acceptable to becoming unacceptable. These convoluted rules are a crippling administrative burden and do not guarantee quality care as intended. Despite our licensing standards, child maltreatment cases continue to rise. The only real protection against harm is quality standards and healthy, secure relationships in childcare settings. DCYF simply does not have the capacity or the day-to-day perspective to enforce this effectively, nor does the legislation. Let me be clear. I fully support licensing and regulations. 90% of a child's brain, our own brains, developed by the time we were 5 years old, and the return on investment for quality care is 1 to 17. The impact of high-quality care is enormous, and the cost of getting it wrong is devastating.
Strong, rigorous licensing standards are imperative to the well-being of Minnesota's children. Respectfully, I do not know any teacher or director who would support the American experiment's suggestions. This is why we need a state board for quality. Just like medicine, law, and public education, a professional board can define and monitor best practice, support providers, family and center-based, and ensure accountability. Licensing should focus on what truly matters: safe, nurturing, and developmentally appropriate care. A board would shift the focus from confusing and punitive administrative minutia to what actually improves outcomes for children. We cannot afford to push more providers out due to the profoundly broken system we are forced to work in. I urge you to adopt this amendment. Minnesota now has the opportunity to lead the nation in truly high-quality, accountable childcare. A state board is essential to make that happen. What is before you now is an incredible opportunity for a transformative change that would benefit young children across Minnesota, something the current modernization cannot achieve on its own. Thank you.
Thank you for your testimony. And our last testifier, Amber Sidlaski, please say your name correctly and proceed.
Good evening, Chair and members of the committee. My name is Amber Sidlaski. I am a child care provider in Orono. I want to start by saying this. As a provider and knowing many other providers, we all want a safe and high-quality child care for the families and children that we serve. The modernization draft, however, as Bill SF 4324, still reflects a system that is being built around providers and not with providers. It does very little to actually modernize how we operate child care programs. Instead, it mostly repackages how we've been doing things for decades. It doesn't address the language that is confusing, subjective, and continues to add burdens to what is already a struggling system. The rules are not clear. Both licensors and providers have different interpretations, and the outcome doesn't reflect the quality of care that providers are actually delivering. In the process of hiring new staff, for example, I've interviewed people coming from other centers in other cities or counties where all of their college credits had counted towards their qualifications. And then when I try to hire them in my city, I'm told that their credits do not count and that they will not qualify. It is mind-boggling without any clear answers. The solution that Senator Boldon included in your documents, which recommends the Minnesota Board of Early Care and Education, would consist of experts in best practices for health, safety, and quality, and those who are most impacted. The board would then have the flexibility to bend and change policies as best practices are improved. That board can provide the necessary expertise to ensure that every child in Minnesota is receiving the highest quality child care. I urge you moving forward to include both modernization licensing rules and a board, because one without the other is just insufficient. Thank you so much for your time for hearing all of our testimonies this late evening.
Thank you for your testimony and for everyone who testified. Senator Wiklund, any comments before we move to discussion?
Oh, thank you, Madam Chair. I'll just say that I've taken some notes on some things I've heard, and I hope that I can go through the bill and to maybe ask some more specific questions of some of the testifiers and, over time. What I did want to allow by hearing the bill tonight, we do have, like a couple weeks before we will be putting together our budget omnibus. And so I really wanted to get the language out and discussed in committee so that we can be taking more input. And I'm really open to hearing from people about specific things that, concepts that they still find are unworkable or have questions about. I do think that some of the things that were brought up have been talked about and addressed, but I'm open to making more suggested changes too. So thank you.
Very good. I will open it up for questions, but sort of on that note, I know we're not taking amendments tonight, but would just refer to the A2 amendment, which we heard a bit of mention from the testifier, but this would submit that for your consideration as you move forward with your work on this bill. It would establish a Minnesota Board of Early Care and Education, a board in statute to oversee quality across all major care and education settings and perform some other functions in that space. It would create a single expert body to develop program quality standards, strengthen educator qualifications, and align existing state supports so we can really focus on improving the availability of quality options. And so I'm happy to have further conversation with anyone about that. And I won't go into a great more detail at this late hour, but like I said, happy to have more conversation. Other questions or discussion, members? Senator Curran.
Thank you, Madam Chair. And Senator Wiklund, so we've got a couple weeks. When do you plan to then do amendments and walk through what we have?
Senator Wiklund.
Oh, sorry. Thank you, Madam Chair. Senator Coran, I will, we can figure out a way to organize it so that, we have an opportunity to talk about amendments. Right now, our schedule is after break. We have a few more budget-related bills that we will be talking about, and then we will be working on the omnibus. I would see this as the language needing to go into that, so we would need an opportunity to be able to, vet and discuss amendments at that point.
Thank you, Senator Wiklund. And so I think we've heard from, today, all the testifiers. We still seem to be missing the understanding from DCYF to what an in-home daycare really is. And we keep creating, and I think we talked about it in the last version about recommendations, right? Good practices and things that could be included in a home. But the people who determine what's needed in a home are the families who come in and interview the next best thing to mom, or the next best thing to grandma, or the next best thing to sometimes Papa Mark when I'm the backup in our in-home daycare. And so I'm fully confident, right? We have to focus on safety and security, but it seems to keep reaching well beyond into what a daycare center is. And a daycare center, by its pure nature, you don't get to interview the people who are taking care of your children. In the case of a in-home daycare, you do. You do an assessment the moment you drive in that parking lot or the end of the yard, walk through the house, and those are the most important aspects which seem to get lost in this regulatory burden from what DCYF keeps putting forward. And so the curriculum, right? It must have curriculum. 3 different types of things to do? What's a proper play components out in the yard? Those are all so subjective, and we've seen what overregulation did. We were here 10 years ago, and we were arguing about stupid things. A plunger was found near a toilet, and a spouse was doing dishes with children present. We're not that far away from it when it continues to be so subjective in the definition of what is a requirement, and is it a safety requirement or just a useless regulation? So I think we got a lot to do, and I really appreciate you taking the time to hear it tonight or to get started, and then give us a couple weeks to digest it for everybody. And so we'll continue to work with the families, and at some point, I think we are the legislature. And so we're going to have to move forward what we believe is the best, and DCYF's job is to implement it. So I do appreciate the time. So thank you, Madam Chair.
Senator Wiklund. Okay. Senator Kupek.
Sure. Thank you, Madam Chair. Senator Wiklund, this come a long way since round 1, and people went around the state and took input. So thanks for all of your very, very hard work on this. And I don't know, you're still open to taking more suggestions, and it has come this is a much, much, much better document than we saw last year, and far better than the one we saw 2 years ago. So appreciate all the work on this, and look forward to putting something, that is clear and understandable, and that is hopefully a good direction to send people in. So thanks.
Any closing comments, Senator Wiklund?
No, Madam Chair, I'm just really appreciate the time tonight, and appreciate members sticking with it. It is getting late, and I like I say, I'm open to hearing more suggestions and developing additional amendments and talking through this to see if we can get it done this year. So thank you.
Very good. That being said, Senate File 4324 will be laid over, and we have reached the end of our agenda, and so we are adjourned.